Well, I'll say good morning for those in the time zone here in New York. Good afternoon for those further afield. Thank you all for being here today. Um, Cities Matter, Resilient Cities After COVID-19 is, as you know, a virtual conference sponsored by UN Habitat, the Consortium for Sustainable Urbanization, and the American Institute of Architects New York chapter. To start things off, I am happy to introduce Christopher Williams, PhD, Director of the New York office of UN Habitat, the United Nations Human Settlements Program. Previously, Christopher served as Executive Director of Water Supply and the Sanitation Collaborative Council in Geneva, wonderful city. Christopher will be our host for the opening plenary and will introduce our initial speakers and the keynote. Chris, the floor is all yours.
Thanks very much, Rick, and greetings to colleagues in different regions of the world. It is my honor on behalf of UN Habitat to welcome you to this program. We have a really excellent program for today. I wanted to emphasize that the United Nations has really been seized with the issue of dealing with the COVID crisis, both in the emergency response and the longer term efforts to respond and recover. In particular, the Secretary General has been quite keen on the issue of this topic today to look at the concept of COVID in an urban world, how cities were really on the front lines of the pandemic and how they dealt with them. This inspired our organization, UN Habitat, to develop a publication known as Cities and Pandemics, which looks at a number of the issues that we will be discussing today. And it's really encouraging to see the partnership with CSU and the American Institute of Architects take up many of these same issues. I'm really excited that today, in addition to this introductory session, we will have a thorough discussion on health, the linkages between urban form and health, urban planning and health outcomes, the whole question of science and its relation with technology. We use the term smart cities. What does it mean in the COVID context? How do we deal with inequality and sustainability? And of course, government. And I'm really excited that this session will deal quite clearly, given that the pandemic has shown the importance of public goods and the role of the state. With these initial remarks, I wanted to introduce the distinguished panelists of this opening session. These are His Excellency Volkan Bozkır, the President of the United Nations General Assembly, who will be giving a video address today. He has served as Turkey's Minister of European Affairs and concurrently as the chief negotiator for the Turkish accession to the European Union. We'll also hear from Peter Exley, is the president of the American Institute of Architects and the co-founder of Architecture is Fun, a Chicago-based architecture and design firm, where his projects include DuPage Children's Museum and the Exploration Station Museum. We'll also be hearing from Kenneth Lewis, is the AIA president of the American Institute of Architects New York chapter and the managing partner of SOM New York's office, where he has worked on a diverse range of projects, including mixed-use developments, commercial and residential towers, corporate headquarters, and healthcare facilities. A very Renaissance man. Alian Selek, my mentor and colleague who previously held the position that I'm currently in as the director of the New York office for UN Habitat, has gone on to become the board chair of the Consortium of Sustainable Urbanization and is the CSU founding board member. Previously, in addition to working with the UN Habitat, she also worked with the Department of Economic and Social Affairs in New York. We're glad to have her and the four distinguished colleagues on board. The full biographies, for those that would like to see them, are available on the Consortium of Sustainable Development, the Consortium of Sustainable Urbanization website, and feel free to look at that. Let's start, if we could, with the opening remarks of His Excellency, the Ambassador and President of the General Assembly. Over to you.
Your Excellency, Ms. Maimuna Sharif, UN Under-Secretary General and Executive Director of UN Habitat, distinguished leaders of the Consortium for Sustainable Urbanization and American Institute for Architects. I am delighted to have the opportunity to speak to you via video message and would like to congratulate you as you celebrate the 12th year of collaboration. Ladies and gentlemen, our world has changed irrevocably in the past year. The pandemic has undeniably demonstrated the connection between the urban and natural world. In September, at the first ever United Nations Biodiversity Summit, at head of state level, I reiterated the scientific community's clear message that I will share again today. The degradation of local and regional ecosystems, unsustainable agricultural practices, and the exploitation of natural resources are putting critical pressure on world ecosystems. Our unsustainable use of nature increasing the risk of zoonosis when infectious disease jumps from a non-human animal to humans. As we have seen from COVID-19, urban areas are the ground zero of the pandemic, with 90% of reported cases. Cities are bearing the brunt of the crisis as they heroically try to manage strained health systems and inadequate water and sanitation services. As we take steps to recover from the COVID-19 pandemic, we must look beyond where we were a year ago. Before the pandemic hit, we were already too far behind. We must look to recover better from where we were before. As President of the General Assembly, I have been advocating that efforts to recover from the pandemic align with the Sustainable Development Goals and sustainable urbanization. Let me share some of the key points that will be relevant to today's discussions and have been raised in General Assembly events that I have convened this session. Firstly, the digital divide, including along rural-urban divides and societal fault lines within cities, risks becoming the new face of inequality and risks leaving the most vulnerable even further behind. Secondly, the One Health approach that puts human and planetary health on equal footing at all levels must be adopted. This approach is critical to avoid fueling antimicrobial resistance and a future in which all our medical advances are useless. And thirdly, reformed food systems along urban and peri-urban lines are critical to ensure food security, fight climate change, and protect biodiversity.
When you call.
Ladies and gentlemen, the new urban agenda is a clear blueprint for the sustainable future of cities and human settlements. Thoughtful stewardship of rapid urbanization can be part of the solution for a sustainable future. As I said during the United Cities and Local Governments World Summit last November, cities, local governments, and parliamentarians are driving critical action across the entire SDG agenda. Green recoveries driven by cities and urban areas can be a prime example that catalyze national level responses. Local institutions are often the closest and most direct form of governance. They are essential to meet the needs of the people we serve. They must be open, accessible, and responsive to citizen needs in order to be effective. Local governments and subnational frameworks are key in building disaster risk resilience. As we build forward stronger, it is essential to equip local governments with the resources and resilient mechanisms that equip them to deal with crises as they evolve, and with the specificity that local governance structures are able to provide. The disaster risk reduction and the Sendai frameworks take a necessary whole of society approach that includes local governments. While connections are being made, Greater cooperation and coordination at the city, local, regional, and national levels is needed now to accelerate efforts to build back better and to adopt sustainable infrastructure for the years to come. In conclusion, let us recognize and celebrate the elements that make our cities great: cleaner, breathable air, green spaces, and access to health and social services. To keep up momentum on urban issues, next month I will travel to Nairobi to attend the UN Habitat's high-level midterm review meeting of the Committee of Permanent Representatives. Thank you.
Well, thank you in absentia, Ambassador Bosker, President of the General Assembly. We're very encouraged with your comments, and of course, we're very encouraged of your upcoming mission to travel to Nairobi, Kenya to attend the high-level midterm review convened by the Committee of Permanent Representatives in Nairobi, Kenya. Up next is Peter Exley, President of the American Institute of Architects. Over to you, Peter.
Good morning. I'm here today speaking to you as President of the American Institute of Architects. My brief comments are about what matters. To my esteemed colleagues in this plenary session, thank you for your leadership at the United Nations and at the New York chapter of AIA. To those of you listening and watching today, I think we all share a sense of purpose with the Consortium for Sustainable Urbanism and UN Habitat. New York members of AIA are so frequently involved in these sorts of programs, and their collective voice keeps architects at the center of the conversation. However, for us all, the time for conversations is over. We must take action, and we must continue to make progress in line with the UN Sustainable Development Goals. We must also be uncompromising in our message, the same message represented by today's conference. Health matters, science matters, government matters. The double entendre in using matters as a verb and a noun shouldn't be lost on any of us. But too often, the matters or issues that occupy us eclipse the fact that our actions today at this crossroads matter incalculably. I'll say it another way. Our issues were not resolved in the last election. Politics and partisanship distract us from our responsibilities as citizens of the world. Occupational boundaries limit our imaginations and our effectiveness. And money and economic inequality carve valleys between us. Half of the world can only do so much to help, and the other half must fight over so little opportunity. Our actions matter incalculably because we can, in fact, calculate the environmental degradation of our world. Our actions matter incalculably because the calculation is all too clear. Be better stewards or find another planet to move to. How will we resolve our issues? That's a work in progress, but I can tell you where we will resolve them: at the intersection of health, science, and government. If I have one message, it's that every one of us shares in the responsibility. The AIA, for which I speak, has committed so many of its resources to sustainability, climate action, and building a more equitable and just world. Architects, a profession that is far too diverse for me to represent adequately, are uniquely positioned to work at this intersection I mentioned a moment ago. Where health, science, and government meet is an opportunity to create net zero and net positive buildings. It's an opportunity to create healthier spaces and places that complement nature rather than dominate or destroy nature. And it's an opportunity to rewrite codes and regulations. If this plenary session demonstrates anything, it's that architects and UN Habitat stand together in finding solutions to problems. More than that, we move together in executing on those solutions. Thank you.
Peter, thank you very much for your comments, and we're very grateful for the representation of the leadership of the AIA at this session. I'd like to shift now to the New York chapter of AIA, Kenneth Lewis, currently serving as the president. Ken, over to you. We can see your slide, Ken. Over to you.
And I believe you're muted.
Here we go. Thank you again. Boy, I'll start again. So thank you. And so well said, Peter. And thank you, Aaliyah, Rick, Lance, Christopher, the CSU and UN Habitat for organizing and hosting such an important event. And thank you, Your Excellencies, worships, and esteemed professors for joining us today. It is a real honor to be with you. The American Institute of Architects New York chapter has some 5,500 global members, architects, planners, and urban designers, our 27 committees, and our leaders look for change in both our city and work for change in both our city, region, and across the globe. We speak for and to our communities through engagement, advocacy, convening, like today's discussion of resilient cities. I'm also an architect, a planner, a partner at Skidmore, Owings, and Merrill, an international, global collective and research practice of over 1,100 people. Architects, engineers, scientists, and designers working and thinking about urban form and resiliency. I would like to briefly share one of our thought pieces prepared in the midst of COVID by my colleagues Dan Ringelstein in London and Pete Kindell in San Francisco. I thought it appropriate to share today. Are you seeing my screen?
Yes, we got it.
You've got it. So the recent pandemic has created an unprecedented impact on urban life and social interaction. The very existence of cities has come into question. In the past, infectious disease, as we heard from His Excellency, have been at the center of cities and urban. Most of those are underway and under control in the Western cities and developed cities, but it's not always the case. And today we are facing a new set of diseases that come out of urban life. Urban density has obviously increased over the years. And while responses to these epidemics has been drastic, the boulevards in Paris following the cholera epidemic at 1832, they have also changed our cities in amazing ways. Central Park was a response to it, the Croton Aqueduct, which I happen to live next to. In London, the massive amount of hospitals that were built, and the Metropolitan Board of Works was established. Sometimes these ideas are grand visions for cities, and luckily they have not come into play. This is a moment to think about other ideas. Rather than propose radical changes that rarely see realization, we must instead embrace cities as organic, resilient urban ecosystems that can adapt and be directed towards specific accelerated change. Despite the current pandemic, cities continue to offer tens of millions of people a place to live, work, recreate, meet with their daily needs and benefits. Sorry.
Don't worry, we're reading and we really like it. Go ahead.
Sorry about that. Despite that, cities are needed now more than ever, but how can we make them better? So there are 5 ideas that you see before you: the pedestrian city, the just city, the cellular city, the porous city, and the network. And I'll talk briefly about these ideas as my time is limited. The pedestrian city is one where streets are the place where we need to rethink as public spaces to provide mobility, provide more flexibility, soft mobility patterns, as well as provide for space for social distancing. Again, this is really a piece that was done in the midst of it. And reconsider underutilized spaces. We must prioritize people over vehicles in the design of our streets, plazas, and other spaces. Transform our streets to create more physical space for walking and cycling. Retrofit our public spaces, plazas, and parks to meet social separation goals without jeopardizing access. Frankly, to create more community. We also need to look at our playgrounds in a different way, creating a place for a much broader spectrum of people. The equitable city obviously is focused on social and economic equity. It should be done through constituent-driven focus, aligning neighborhood and social networks with local physical space, mandating grassroots approach to urban design through local community initiatives, and advocacy for education and advanced skill training that focuses on human development. We look at the poorest city and ask ourselves, how can we create greater access to open space by creating new parks and enhancing parks and restoring natural systems? We need to expand those systems to promote health and recreation. We also need to look at outdoor spaces, rooftops, balconies, and other areas to meet dining and shopping, as well as minimize virus spread. Probably most significantly, we need to strengthen and restore ecosystems, increasing proximity to nature. The poorest city is really a moment to address long-term climate change by looking at our transportation systems, our connectivity, and really ending the age of the motored vehicle. The cellular city is about looking at urban districts and how we reconnect them, looking at multiple sub-districts characterized by varying density and land uses. Also, the idea of more residential uses in commercial areas, the idea of mixed use, something that's dear to my heart. Again, the local neighborhood centers are key to this, taking pressure off of city centers. The urban density has to be appropriate, and critical mass is so important to that context. We also need to look at our local shops who have suffered through this horrible pandemic and increase the choice, services, and connectedness to those shops. I think the suffix that we're all calling for is really true and has been happening. It's happened right in our own homes through co-living, co-working, co-making, and co-learning. But how do we transform that into our cities? The last thing is the network city, a city of networks that are connecting with different densities of live and work hubs, reducing pressure on mass transit and really strengthening the last mile transit. Restructuring our transport systems from hub and spoke to multi-directional networks, hoping to optimize incredible savings, again, as part of our pathway to carbon neutrality and, frankly, carbon sequestration. Diversifying our modes of transport has happened right in front of our eyes, again, reducing pressure on mass transit systems in which proximity is fear. Advocating for polycentric cities by densifying areas around transportation hubs. Transit-oriented design is the term. And just to look at suburbia as well. Suburban areas that surround those cities can also become those mixed-use districts that provide the connectivity, culture, and centers that will reduce that transportation. I want to thank you again for organizing our leaders in the Consortium of Sustainable Urbanism, UN Habitat, and my colleagues at the AIA New York. This is a great event. I'm so glad to be part of it.
Thanks very much, Ken. Really appreciate the overview, and we're grateful for that. I think the concept of managed density is something we're all wrestling with, and the different streams that you've urged us to think through to help that happen is terrific. Thank you so much. I'm now shifting to Elia Selek. Please, over to you, Elia.
Thank you very much, Chris. Distinguished Excellencies, speakers, guests, on behalf of the Consortium for Sustainable Urbanization, it is an honor to welcome you to our conference and thank you for joining us. Before the pandemic, we at CSU wanted to alert everyone who would listen to us that the population of cities will increase by 2.5 billion people in the next 30 years. Therefore, we have to transform existing cities to sustainable cities all over the world. We were lamenting to the fact that we had to do it in spite of the fact that there are huge inequalities, injustices, natural and man-made disasters like climate change, Suffering from a gigantic global pandemic, the necessity of sustainable and resilient cities has become more imminent for saving lives as well as the planet. The CSU has been established to spread the word and try to disseminate workable solutions, innovative thinking related to sustainability of cities, as well as sustainable development goals and the new urban agenda, which are approved by all the members of the United Nations. We think that the residue of the pandemic on the cities of today and how it will impact the future is very important. Therefore, we intend to publish the proceedings of this conference like the conferences we held in the past years. We all have to rely on science, health infrastructure, and good governance at every level, all the time and everywhere. How we should preserve, protect, improve what is sustainable, and look for new frontiers, technologies that would protect the cities and humankind from destruction. This is the question. We are here today to find answers. Thank you for enlightening us. Back to you. Thank you.
Thank you, Aliye. Thank you so much. And we very much appreciate your leadership and that of Lance and others who have helped get the Consortium for Sustainable Urbanization to where it is today. I'd like to thank as well both Ken and Peter and His Excellency President Bozkır with the President of the General Assembly for their introductory remarks. We're now shifting to a keynote address that will be made by Dr. Ashish Jha, Professor at Brown University and Dean of the School of Public Health. It's terrific to have you, Ashish. We are really excited. Many of us know you from your regular presentations on the media, and we're very thankful for the level of thinking and forthrightness that you bring to our public knowledge of this pandemic. Thank you specifically for your work. Excuse me just one moment. Yes, thank you very much. In addition to working at Brown, thank you also for your previous work as the KTI Lee Professor of Global Health at Harvard's T.H. Chan School of Public Health, the director of the Harvard Global Health Institute and senior advisor at Albright Stonebridge Group. Dr. Jha, thanks also for your previous work, research centers on improving the quality and cost of healthcare, focusing on the impact of public health policy. I note that in March of 2020, you called for a 2-week national quarantine across the United States to reduce effects of the COVID pandemic. You were way ahead of the curve for that. We also note your vociferous efforts, advocacy and strengthening healthcare infrastructure, not only the what we see on the surface, but what's below it and what makes public health what it is in the US and abroad. We note that you've been elected to the membership of the National Academy of Medicine in 2013 and named last year by the Boston Globe as one of the Bostonians of the Year. Having clocked a lot of time in Boston, I know what that means. Congratulations. We note as well that you've graduated from Columbia, no stranger to New York, before going on to do an MD and MPH at degrees at Harvard. Ashish, I'm going to turn it over to you, and I'd just like to thank you so much for once again taking time out of your hectic schedule to join us today. Over to you.
Well, thank you. Thank you for that kind introduction and really for this wonderful event, this wonderful conference. In my mind, it's very much an honor to be here, and it's an honor because this brings together, I think, really pressing, critical issues that we have all been thinking about well before this pandemic. But I do want to use the pandemic as a jumping off point to frame why I think cities are going to have been at the heart of the response, and why moving forward, I see this as the beginning of a renaissance of cities that I think will shape the way humanity lives and experiences health for the next half century, if not more. So let me lay out the case for it, and I suspect I might find a accepting audience for that hypothesis. But you know, we are in the middle of the biggest health crisis in a century, but arguably it goes so far beyond a health crisis, right? It's had these profound effects on our society. At one point, I mean, just thinking about the impact on education, at one point last summer, 90% of children were out, last spring, 90% of children were out of school because of the disruptive effect of the pandemic. The cost of this pandemic is going to be measured in trillions, if not tens of trillions of dollars. This is not just a health crisis, it's really a crisis for societies across the globe. You know, when we have societies like this, I mean, we have crises like this, we often think and look to nation states as sort of the organizing principles that will get us out of this. And what's interesting about that is that that's a relatively new phenomenon in human history, that only really since the 19th century have we thought of countries as the organizing principles of what brings people together to respond. And we talk a lot about countries, the American response, the Indian response, the German response. But the truth is that throughout human history, countries have not been necessarily at the heart of responding to crises and thinking about health and organizing health. And I really believe that as we come out of this pandemic, the role of nations, while important, will no longer be as central as the role of cities. And let me explain why I think more and more cities will become the heart of health and health responses to crises. So let's talk about why cities. And when I think about why cities are so important, I really think of them for three reasons. One is that they're far more enduring social structures than nation states are. And by the way, the point of this talk is not to say that nation states don't matter. They do matter, and of course they matter. But it's to get us to understand that this mental model we've had of countries are sort of dominant and then cities are part of nations. We've got to shift away from that, especially if we're thinking about health. So one is that cities are far more enduring. Second, increasingly, cities are much more dominant in the experience of humans. And third is that cities are much more coherent, and I'll explain all of those. If we go back just to 1950, so 70 or so years ago, there were about 110 nations in the world. 2010, fast forward 60 years, there were 214. Nation states, we sort of think of them as these incredibly stable things, but they're not. Countries split up, countries merge, there are wars, there are all sorts of things that shift around those political alliances. Cities, of course, have been far more enduring than nation states. And so nation states fundamentally, in my mind, are much more fragile. Second is that cities have become much more dominant. And what do I mean by that? You know, and you all know this, but the human species has been, throughout our entire history as a species, a largely rural species. We have lived in rural areas. And then about a half a century ago, that started changing. So even if we go back to that 1950 time period, 70% of people lived in rural areas. 30% obviously lived in more urban areas. Less than 10% lived in anything that we might recognize as a major city. Fast forward to 2020, last year, that 70% has now dropped to about 44% living in rural areas. Our best estimate is that somewhere around 2012, 2013 was a momentous year for humanity because it was the first time in the history of the human race that more people started living in urban areas than in rural areas. And that line crossed right around 2012, 2013. And the major cities now represent maybe 25%, depending on how you choose to define. Major cities represent about 25% of the human population, another 30% in kind of more mid-tier cities, and then the rural areas, as I said, now down to about 44%. All the projections suggest that these trends are going to continue and that the major cities will be where a majority of humans live. And then finally, so more enduring, more dominant, and more coherent. What do I mean by that? When I think about what cities look like, how they're organized, what the underlying drivers of health are within cities, they look far. New York looks much more like Hong Kong than New York looks like many other cities or many other areas of the United States, right? The diversity of the individuals who live in these cities, the dynamism of cities, many of the things we've heard about already this morning, the innovative and rapid changing nature of cities. All of these things give cities a certain set of coherences that are different than non-cities or not than rural areas. And again, in the enduring structure of cities, I think they represent both challenges, which I will talk about, but opportunities for how to build health moving forward. Now, let's talk about this pandemic. The pandemic, of course, has been horrible. We are not anywhere near done living in the United States. It can feel like, and it probably is, that we are rounding a corner and that things are about to get much, much better and the pandemic will feel like it's in a rearview mirror. That is not the experience of the world. Much of the world is in the throes of some of the worst days of the pandemic, with all of the evidence suggesting that over the next 6 months or a year, much of the world, things will get much worse before they get better. So it's important to remember that we are nowhere near done with this pandemic. One of the things that people, I think, often talk about is this sense that this pandemic is going to lead to people abandoning cities, that people running away from cities. I completely disagree, and I'm going to make the case that I think that cities are going to become really the hub for resilience and health and managing health crises. But let's talk a little bit about how cities have fared in this pandemic. The truth is that cities are uniquely vulnerable to pandemics. Why are they uniquely vulnerable? They're uniquely vulnerable because they are the global hubs of travel and trade. And so when a disease outbreak begins in one place and it spreads, it will naturally land in cities first. We saw that. I mean, this began in Wuhan, but it landed in New York, it landed in Lombardy, it landed in these global hubs. In India, it landed in Mumbai first, right? It makes complete sense that cities will be the place where any new outbreak hits first, because they are global hubs. And of course, the second part of it is their density. Density means that the disease spreads much more efficiently in the early days. I would argue that cities are largely not built to withstand pandemics. And one of the challenges we have as a community of both public health individuals as well as people who think about and care about the thriving of cities is that we have to figure out, how do we build cities? How do we make changes to the built environment? How do we think about ventilation and open spaces? And again, we heard some of these issues already raised. But one of the things we've learned about this virus, and this is true of many respiratory viruses, is it's airborne. It spreads through the air. And that means people in enclosed spaces with poor ventilation are going to spread the virus much more efficiently. And so we have to really look at our buildings and our built environment very, very differently, and think about, how do we make buildings safe for infectious diseases? Because the one thing that's very clear in my mind is that this is not the last pandemic we're going to deal with, that there are many more coming down the pike, and we've got to start building around that. Last point on this is that the other lesson from this pandemic is that when cities have been hit hard, not everyone in those cities have been affected equally. That we see the vast disproportionate impact of this on poor people, people of color, at least in the United States. That certainly has been the experience. And it's not random. And it's not random because the bottom line is we have built cities in certain ways, certain types of policies, zoning, where we put highways, where we put roads, which communities and neighborhoods they go through, what impact that has on the kinds of living spaces that are created. I would argue all of those built on inequities, on systemic racism in the United States, that has landed us in a situation where when the disease begins to spread, it does not spread equally. It disproportionately impacts certain populations. And that has been the experience in cities across the United States, but I would argue in cities in the United Kingdom, across the world, that it is never, pandemics affect all of us, but they never affect all of us equally, that they augment and highlight all the structural inequities we have built into our cities. Those strike me as the major challenges that we need to deal with. So how do we now move forward? And again, there are these two competing narratives. And more in the United States, I hear people arguing that this pandemic will be the kind of the death nail of cities. And I think that is not true. I expect a massive revival of cities and more people moving into cities in the decade ahead. But we do have work to do to make sure that cities are safe and that they are built in a way that really promote health. So what are the things that we need to be doing? So I already talked about the importance, and again, there are a lot more people here with a lot more expertise on this than I do. We've got to look at that built environment much more closely and effectively. And that is talking about healthy buildings and how do you build buildings in a way that people can spend time in the indoor space in a way that promotes health, promotes cognition, promotes well-being, prevents infection spread. Yes, it's great to have more outdoor space, and we've got to do that. But majority of Americans, and I think this is true across Europe and other places as well, we spend a vast majority of our time indoors. So how do we make indoor spaces healthier, better? That is clearly one. Another thing is we really have to look at microclimates and local pollution. One of the many reasons why we've seen so much worse outcomes for poor people, for people of color in the United States, is air pollution is a major driver of comorbidities with COVID, something that gets very little attention. And yet what we know is the average African-American person, the average Black person in America living in the same city as a white person breathes air that is about 50% more polluted. Not because we want to look, so the point is you can't look at the pollution level of an entire city. You have to look within neighborhoods. You have to look at micro level pollution data, climate data to really understand what are driving these disparities. Cities need to begin to address those things. The second area where I think cities need to make a lot of progress, and I am very optimistic, is what kind of monitoring systems we build. It's very clear learning from this pandemic that there's a lot we can do to see diseases coming. There's a lot we can do to pinpoint where they're spreading. And there are several things that I think require particular focus. So one of the things we've learned a lot about is the value of wastewater surveillance. Some of the most impressive responses of cities have been those that do really sort of extensive, effective wastewater surveillance of their wastewater system to look for spread of disease. COVID shows up in the wastewater well before it shows up in symptoms in people. And so if you track levels of COVID in the wastewater, you can localize it to neighborhoods, communities, and you can figure out where the next outbreak is going to be days before people start showing up with symptoms and getting tested. That kind of monitoring system needs to be built in, because if we're going to bring people together into closed spaces the way cities are, we've got to have a monitoring system that really works. Third is we've got to focus on networks. And networks are both physical networks, how people move in and out of cities around public transportation, but also social networks, how people interact and engage. And here, I think there's a lot of really important work being done to understand how do diseases spread within cities. And they're not as simple as they just spread within neighborhoods. That social networks within cities are complex and I think need a lot more work. Last point, and then I'm going to finish up, is one of the places where I think cities have been really extraordinary, and this is pre-pandemic, is focusing on building coordinated health systems. And there are just no shortage of examples of when cities have done a good job on this, the impact they've had. Whether this is localizing and more effectively managing stroke in Manchester in the United Kingdom, it's how Shanghai has taken a very different and holistic approach to managing asthma in kids by the way they've built out clinics and the way those clinics send kids into emergency rooms. The bottom line is cities have a set of advantages around coordinating health system response to health problems that rural areas, that suburban areas don't. And this is an area where we need real leadership. And I think what the experience has been is that when those are done, you can improve outcomes, you can lower spending. So big opportunities ahead. Let me just finish by saying that the major lesson for me in this pandemic and watching the impact of COVID on cities has been that we've got to do better, that we've got to build more resilient cities, cities that can withstand health shocks because of climate change, because of deforestation, globalization, we are going to see more pandemics in the years and decades ahead. And we want cities to identify them early, to withstand them, to have to be places where people can be safe and thrive in them. And that is the big challenge of the next decade. I think cities have a lot to learn from each other. I have generally loved the various efforts, the C40 or the other kinds of efforts that bring cities together. But the bottom line is that this trend that we have been on as a human species towards urbanization, I don't think it is going to stop. There are too many advantages, there's too many upsides to bringing humanity together. And we've got to think about how do we build cities that help people thrive in that context and don't become a source of vulnerability in an increasingly globalized, increasingly complex world where the threats to human health are every bit as big as the challenges to human health. So let me stop. I want to say thank you again for bringing us together. I do see, while there are lots of challenges ahead of us for this urban sustainability moment that we are in, I think the opportunities for building something better, stronger, more resilient are so fantastic that if we can make progress on that, it will have profound effects on all of humanity. Happy to take any questions or comments, but I just want to say thank you very much again for having me here this morning.
Chris, you're muted.
Sorry about that. Talking to myself, we know how that is. Thanks, thanks very much, Ashish. Really appreciate your intervention, and I really thank CSU, because it's quite clear that getting out of our comfort zone, and I think this picks up on Peter's point, we have to get out of our institutional boxes, our professional spaces, and begin to listen to folks that bring a perspective to what we take for granted, and challenge our assumptions. And what I am excited about are two levels. One, as a UN official, I have to walk very carefully between the member state and the city in terms of such comments, and I would have to really qualify everything you said in the presence of many of our distinguished ambassadors and the President of the General Assembly. But note fully recognition of the role of the cities and local governments, and really subnational entities vis-a-vis pandemics and public health, given the trajectory of urbanization. I really am impressed with the level of granularity of your recommendations, and I think everyone on this call who's deeply embedded in the built environment has taken note of that. I just cite four really quickly. Not taking the built environment for granted, really rethinking space, and not just public spaces, but actual buildings where we spend most of our lives. The whole question of microclimates and its link to air pollution, absolutely crucial. Monitoring systems, getting ahead of public health crises, looking at things like water systems before the actual frequency of the disease manifests itself in human beings, and that data. Networking, not just the environmental mobility systems, but our societal social networks, how we travel, move, live, a deep rethink on that. And lastly, coordinated health systems. I think all of us who are urban planners, architects, people in this urbanista space, we are needing to take a hard look at the implications for public health. So I really welcome, Ashish, your intervention. You've provoked us, and I think set the stage for the rest of the session. Thank you very much. I'd like to shift now to Rick Bell, who will continue to moderate subsequent sessions. Rick, over to you.
Thank you, Chris, and thanks to Dr. Jha and all of our distinguished prior speakers. It is my honor to introduce the first dialogue session, Health Matters, and I'll be introducing the speakers individually. But I would just like to comment, Dr. Jha, you mentioned two key points. How do we make buildings safe for infectious diseases? And I'm assuming that you meant how do we make buildings safe despite infectious diseases? And I'll take it at that. And also looking at the 229 participants in the room today, it's a phenomenal amount. Thank you all for being here. It occurs to me that many are urbanists, whether they are representing a municipality or a nation state. We have that in common. There are many architects. And your second point, Dr. Jha, about inequity in disease spread is not random, but based on a host of socioeconomic factors, including but not limited to race. And we've built cities in certain ways. I think that resonates with the architects and planners, urban designers in the room big time. I'm going to use as a very, very short invocation, since it is her birthday today, Florence Nightingale, who had probably more to do with changing the healthcare system than any physician, back being born in 1820 on May 12th. She said, "Let whoever is in charge keep this simple question in her head. Not how can I always do the right thing myself, but how can I provide for the right thing to always be done?" One person, our next speaker, who has always done the right thing and is an inspiration to all of us in New York and now in Cambridge and around the world, is Dr. Mary Travis Bassett, a professor at the FXB Center for Health and Human Rights at Harvard University. Dr. Bassett served as commissioner of the New York City Department of Health and Mental Hygiene from January 2014 until August 2018. And I know, Mary, that you were there before and did many, many other things before becoming commissioner. In 2017, Dr. Bassett was elected to membership of the National Academy of Medicine. Mary, the floor is yours.
Thanks very much, Rick. I'm going to try to share my slides, which I may need some audience help at. I hope it works. Are you seeing them? I don't see them. All right. And are you seeing it full screen or are you seeing it as a...
Not yet full screen.
Okay. How about now?
That's better.
And do I need to switch so that you're not do I need to do this? Sorry to take time to do this. Is this
No,
better?
you're first up. That's all right. But we also see your second slide in preview. At least
Oh,
I'm seeing.
then you want it, then we want to do it the other way.
Well, can you hit the screen, icon in the bottom right next to the volume sign? That should do it.
Hang on, everyone. I
Or-
apologize. I should have practiced doing this before
That's
we
okay.
started. I'm going to stop and come back. This is what you get for using slides. So are you happy with this mode?
Good enough. Good enough. Let's get going. Thank you.
All right, I can swap it. Is that correct?
I think it's fine. If we know what's coming up next, it's not the end of the world. If everybody
I
can see
didn't
this.
want to show you those. All right, I give up. I will. The problem is that I can't use my pointer. So it's a real pleasure to be here. And I'm sorry to waste your time with the presentation challenges of Zoom. And now you'll get to see my slides in advance of showing them. So I'm grateful to the organizers. And I'll begin with this, that epidemics really show us who we are. And they did that with the Ebola pandemic, which preceded this one. We'd known about this virus since the early 70s, but it was when it hit the West African slums that it became clear that it could be uncontrollable in urban settings. And these were settings which none of us had really paid attention to, maybe many of the audience had, where there were literally none of the advances of 19th century public health. There was no water, no sanitation, no roads, and this cost us at least 11,000 lives. So I'm going to speak mainly from New York City, where Rick pointed out that I was health commissioner. And I hope that the audience will bear with me. New York City is a global city. 40% of its population is foreign born, and the majority with their children, they form the majority of the population. It is a city in which there is no majority racial ethnic group. The largest minority group are people classified as whites. And although its iconic skyline reminds us all of its power as the financial capital of the United States and one of the financial capitals of the world, half of the population lives at or near poverty. It is a deeply segregated city for historical and contemporary reasons, as well as being one which racially segregated, as well as being one in which many people live in ways that aren't reflected in that highline. This is an example of the type of housing stock where many of the people who live who are not among the images that you may have of New York City. And when the pandemic struck, these data were made available in the New York Times. People started fleeing the city. Dr. Jha has talked about this idea, but most of them were wealthy people. And this neighborhood down here is one of the wealthiest sections of New York City. The darkest color, 40% of people left the neighborhood and left the city altogether. And this shows that the top 1% left very precipitously. New York City shut down May 15th, the schools closed, and the top 1% left the city. But as Dr. Jha predicted, they're coming back. And of course, as a strategy for containing the pandemic, it did not succeed. This highly contagious virus that spread through the air has gone everywhere, and it has affected the United States really tremendously and very tragically. The world has lost 3.3 million people, and the United States is headed towards 600,000. It's over 580,000 deaths so far. And this is what the distribution of infection looks like in New York City. Some of you may remember that this was the neighborhood where people were living, and they didn't actually see at any point during the pandemic that many cases of COVID. It was in these outer boroughs, in the Bronx, the poorest county in New York State, and in the United States, continental United States period, Queens and Brooklyn, communities that are majority Black and Latino, where COVID struck the hardest, with mortality rates up 2 to 3-fold higher among this population than it was among whites. And not only were the Black and Latinx population dying at higher rates, they were dying at younger ages. And people start talking about the danger of the city, and the city regaining this image that it had historically as a place of contagion. They attributed it to density, and that's the main point of my remarks, that whatever time of day it is for you. New York, Manhattan, the wealthiest, widest part of New York, has the highest density in New York City, more than twice that of the Bronx, the poorest county in New York State and in the US. But it has much lower rates of crowding. The Bronx is more than twice as crowded. This is the number of people living inside your home. So it was the crowding that posed the risk. I can talk a little bit later if it comes up about Staten Island. This is largely civil servants who've had to keep going to work. So it was crowding, not density, that posed a huge threat. And it was the fact that many of the individuals who lived in these crowded, often multi-generational households, were still going to work because they were classified as essential workers. And New York City had 33,000 deaths. I was looking for the number of deaths in Seoul, Korea, another big city. Has actually about closer to 10 million people. I couldn't find it for the city, but the whole country of South Korea had under 2,000 deaths attributable to COVID. And so it was not the density that posed the risk. It was the crowding, the fact that people live on top of each other, and they don't do that as a lifestyle choice. They do that because they lack access to housing that they can afford. People live in multi-generational households for similar reasons, at least in the United States. That was certainly one of the vulnerabilities that Italy had. And these are people who also were taking crowded public transport, continuing to work, often with few labor protections. As an immigrant city, nearly 20% of residents in New York lack documentation. So they don't have the types of legal protections readily available to them, or they're afraid to invoke them. And of course, the US lacks health insurance as a national benefit. And many people who have health insurance still can't afford to take time off work to seek medical care, can't stay home from work because they lack insurance. So all of these things create the high levels of poverty, which in the US often is accompanied closely by racial ethnic classification. And the structural impact of these vulnerabilities led to the ravaging of New York City by COVID-19. Of course, good things happened also. The city streets were closed so that people could have broader pedestrian walkways. One of the speakers has already referenced that. Cycling was made more accessible by closure of city streets. The public transport run more frequently. Buses were made free so that people could simply enter them and not have to gather at the front door. The expansion of outdoor activities of all sorts, including dining outside, and then policy changes, and other jurisdictions have done this. The ending of evictions. All of this, I think, are examples of the types of changes that cities can see that will make them safer as well as more sustainable. And I can't end without also noting that there were as a public health person, that there were real innovations in data. The ability to track where people move, whatever we think about it, was made possible by cell phones. The fact that we had these huge racial ethnic disparities, but often didn't have the data to measure them, has made our data better. The data have been made public, and that is necessary if we're going to be able to track equity. And then new innovative uses of wastewater, for example, as tracking the presence of the virus in the population had moved to center stage as a method of public health surveillance. So it was the structure of our city that made New York City so vulnerable. And that is what will have to change if we're going to make it safer, both the social structure and its physical structure. Thank you. And apologies for my slides backwards. Let me stop sharing if I can figure that out. And
Thank you, Dr. Bassett. I have many comments and thoughts on what you just related, but I'm going to hold them until after the other two.
Yeah, I have to figure out how to stop sharing. I'm apologizing.
Just hit the share icon again. There we go. I'd like to introduce our next speaker of this three-person panel, and she is Dr. Shima Hamidi. Dr. Hamidi is Bloomberg Assistant Professor of American Health in Environmental Challenges and Assistant Professor with the Department of Environmental Health and Engineering at Johns Hopkins University. She was the founder and director of the Center for Transportation Equity, Decisions and Dollars at the University of Texas. And in 2017, Dr. Hamidi was named a presidential fellow, which is quite a distinction. Shima, the floor is yours. I hope you can share your screen.
Thank you, Rick, for the introduction.
Please unmute first.
Thank you. I am going to share my screen. Hopefully it works. Okay. Okay. Can you see my screen? Okay, perfect. Thank you so much, Rick. It's a pleasure to be with you in this fascinating event. My presentation focuses specifically on the intersection between the built environment and COVID-19, looking at density versus crowding. I was excited to see that the previous presenter also mentioned that a little bit. But what my presentation is going to focus is at the national, like the larger scales of the concepts behind built environmental determinants that would affect COVID-19 pandemic, both infection and mortality rates, and what would be the implications for the future of the built environment. So what do we mean by the built environment? If we look at these two images, we see two ends of a spectrum. In one end, we do have a more compact, connected types of development with the concentrations of employment and population, mix of land use and housing options. We have cafes, restaurants, workplaces, housing, different housing types all together in the same neighborhood. We do have strong centers that would give people a sense of community, and the kind of interconnected street network which would are designed for people, are designed to facilitate and encourage walking, being physically active, cycling. On the other side of the spectrum, you will see something that is more of the stereotypes of the American cities. The sprawling types of development, very low concentrations of employment and population, single-use buildings, mostly single-family detached, without any types of urban center, no identity, cul-de-sac street patterns that gives you no option but to drive. They force you to drive everywhere. You want to go from point A to point B. And, you know, these two comes with a very different sets of quality of life outcomes. I myself spent my lifetime, my life career looking at the quality of life impacts of urban sprawl. And I wrote more than 30 publications, journal publications on that. They led to the emergence of food deserts. They would impact traffic crashes and fatalities. Traffic fatalities are 3 times higher in sprawling areas than compact. They would impact chances of upward mobility and our access to opportunities. They would impact housing and transportation affordability and how much budget is remaining for healthcare, insurance, and other health-related expenses. And I mean, if you look at these impacts together, they would make a difference of about 3.5 years in life expectancy, living in a more compact versus more sprawling areas. To give you an idea of what does it mean, according to CDC, if there were a cure for cancer, the improvement in life expectancy would be about 3.5 years. So you can do that through the built environment and you know, healthy urbanism. Let alone the climate change impact and GHG emissions that would come with more driving and car-oriented types of development, which is the nature of sprawling areas. Well, this has been guiding the urban planning, you know, movements such as smart growth and new urbanism in the past couple of decades until the COVID-19 emerged. And, you know, all of a sudden, you know, we've been seeing all this news about density being blamed for what's happening in New York and other cities, calling that the, you know, sacred, you know, basically calling sprawl the sacred weapon against COVID-19. And even among the policymakers, the governor of New York, for example, this is a quote from Governor Cuomo from CNN. It's very simple. It's about density. It's about the number of people in a small geographic location allowing that virus to spread. Dense environments are its feeding grounds. And, you know, it has already impacted to a great extent people's opinion about the built environment, their preferences about the built environment, and even among the policymakers. I'm going to show you a couple of examples. But what we did was to look at some of these these relationships in a more quantitative way. We looked at the entire US, all counties in the US. We include 913 metropolitan counties. We looked at all different factors that would make a difference in COVID-19 infection or mortality rates. Socio-demographic characteristics, social inequality, look at travel and tourism, healthcare facilities, access to resources, as well as density, to see what really you know, is the impact of density, and if that is what people think would make a contribution to this pandemic and future pandemics. So what we found, I don't want to go into details of this study. We did 2 or 3 follow-up studies. All of them consistent in our findings. We found that the COVID-19, the density contributes to the significantly lower mortality rates from COVID-19. Why that might be the case? I mean, the areas that are more sprawling, suburban, exurban, and rural areas, I mean, every place in the US or internationally hit the pandemic sooner or later. But what happens in those sprawling or rural or exurban areas is that they don't have access to healthcare, both testing and the treatments and ICU and other emergency facilities needed to handle the pandemic. While in a more compact, denser areas, you will see they are better prepared to handle the pandemic. We also found that density is not significantly related to the COVID-19 infection rate, possibly because on one hand, density could facilitate spreading the virus, but on the other hand, in the dense, compact places, people are more precautious about the threat, versus what you see in more sprawling areas is that people think they are safer and they are not, in risk as much as compact areas, and it makes them less, less cautious. But then if it is not density, what it is? So I want you to see these two images. None of these are dense places, none of them. And in fact, they are among the more sprawling types of environment. These two images are captured during the COVID-19 pandemic. I think it was like May or June last year when we were at the peak of the first wave. And you see that this is really what facilitates the spread of virus. It's what's happening inside the buildings. It's different from density. It's really the concept of crowding, the concentrations of people, all in an enclosed place, in an inside environment. And what, for example, we found happened in New York City, we did a more detailed study there, was that the number one most significant factor that would contribute to the increased infection rate was overcrowded housing. Overcrowded housing that most often is, is occupied by minority, low-income population. That is what was significantly related to the increased rates of COVID-19 infection. But I mean, as I mentioned earlier, this misconception of density is already coming up with its practical impacts on the ground. According to a survey in May 2020, about 27% of adults and about 43% of millennials who were surveyed, it was a national survey in the US, said that they're considering moving to suburban and exurban areas. Businesses are following them with suburban office relocations. In another study, the United States Commercial Real Estate Services reported that in the first quarter of 2020, 9 out of 10 largest office markets in the US recorded an increase in downtown vacancy rates of 30 basis points as compared to the 10 basis points in suburban areas. Well, I saw a tweet even from policymakers, like in New York, the governor and the mayor were saying that we should plan for de-densifying the city in order to make the city less vulnerable for future pandemics. Our study and similar studies in the line would suggest that decision makers should continue to practice and advocate for compact places rather than sprawling ones due to several environmental, transportation, health, and economic benefits of compact development confirmed by dozens of empirical studies. And what needs to be done is to pay close attention to crowding, especially at the early stages of the pandemic. Crowded businesses, crowded bars, crowded restaurants, crowded housing, crowded public transit. That really should be the front line of policy making when we are dealing with the built environment and COVID-19 and any future pandemics, not really planning for de-densifying the city. I want to end my presentation with this quote from our study, that the fact that density is unrelated to confirmed virus infection rates and inverse related to the confirmed virus death rates is important, unexpected, and profound. It has implications for community design, regional planning, transportation expenditure, urban redevelopment, tax policy, congestion pricing, smart growth, affordable housing, and nearly every other front burner issue important to planners, designers, and policymakers. Thank you. I'm happy to answer any questions.
Thank you. Thank you, Shima. That was excellent. A lot of food for thought. I want to stay on schedule, so I'm going to do a very short introduction. There are longer bios on our CSU website. Our next speaker is Mr. Edward Masria, FAIA. Ed is founder of Architecture 2030 and the recipient of the 2021 AIA Gold Medal. He's a native New Yorker and a graduate of Pratt, and is one of the most foremost experts in the world on the built environment's role in both causing and curing climate change. Ed, the floor is yours.
Thank you. If we can have the first slide, and I'm going to now zoom out globally and talk about another issue that's affecting us and affecting cities everywhere, and that's climate change. So let's begin next. There's a famous saying by a famous baseball player, actually, Yogi Berra: if you don't know where you are going, you'll end up someplace else. Next. A New Yorker, by the way. So the difference between, so I want to talk about the difference between 1.5 degrees C and 2 degrees C. That difference, that half a degree, leads to two very different futures. Next. At 2 degrees C, we begin to see a whole bunch of various things happening. Next. First, 1.7 billion more people from 1.5 to 2 will be exposed to severe heat waves every 5 years. Next. 100 to 400 million more people will be at risk of hunger. Next. 1 to 2 billion more people will no longer have adequate water. Next. And at 2 degrees C, 1 billion people may be forced to migrate. So you can see that it's not only a planetary problem, but it's a huge health problem. Next. So the issue is fossil fuels. We all know that, putting CO2 into the atmosphere. Next. And to understand what this means is we have in order to stay at 1.5 degrees C, have a good probability, we have a carbon budget of 340 gigatons of CO2. Right now, we emit about 40 gigatons a year. Next. You've all heard this, this notion that we want to phase out CO2 or get to net zero by 2050. It's essentially too late. It gives us less than a 50% chance of meeting the 1.5. That's 600 gigatons, almost double what our carbon budget is. Next. So in order to meet the carbon budget, we need to reduce our emissions by 65% by 2030, and then phase out all CO2 emissions by the year 2040. Is that doable? Next. Next. So when we talk about the built environment and we're talking about carbon emissions, we're talking about three things: new buildings, existing buildings, that's building operations, and all the materials and construction that goes along with putting these up: the sidewalks, the roads, the connections, the sewer systems, the piping. Next. So how do we get a handle on this? For new buildings, it's actually quite simple. Next. It's building codes. We need good zero carbon building codes. They exist today, national and international standards. The International Energy Conservation Code adopted it in its latest code and just published it. The EU is supposed to go to zero carbon this year, and even China has a zero carbon code standard that they developed. However, they're not being adopted yet, and so that's the key. The key is to get these adopted as soon as possible. Once we do that, emissions in the entire building sector stops and flattens out. And then as we add renewables, we begin reducing emissions next. So second, what do we do about the literally hundreds of billions of existing buildings worldwide? Next. Well, we need to make them a little more efficient. We need to electrify them, get rid of the natural gas on site or heating oil, and go to renewables, non-fossil fuel, CO2 emitting electrical energy. Next. So how do we do that? Well, next. We discovered something very interesting in New York. When we did a study for New York, we discovered that less than 2% of the total number of buildings in New York, which are about 1 million, are responsible for almost half of all of New York City's emissions. Those are buildings over 50,000 square feet. Next. So very few buildings responsible for half of all the city's building sector emissions. We find the same thing in almost every city worldwide. If you look at Chicago along the waterfront, big buildings, then miles and miles of small buildings. Same thing in Istanbul. Next. Same thing in Nagasaki along the waterfront, large buildings, and then miles and miles of small buildings. Sydney, a handful of large buildings, and again, miles of small buildings. Next. So that leads us to a 2 buildings policy. One is you give the big emitters, the big buildings, there are very few of them, by 2030 to get to zero carbon. They'll usually hit a renovation cycle by that time, and it's very inexpensive to upgrade to electrify and then use renewables. And then with the small emitters, you look at intervention points at building sale and different, when they're replacing equipment, you require them then to electrify and go to renewables. That way you can get the entire built environment, building sector, to zero carbon operations by the year 2040. Next. So it's not rocket science. Let's talk about materials, construction, and infrastructure next. This is the way we see it. All that falls into industry. That's 43% of total global emissions. That's everything that's made, every product. There are literally trillions of products. How do we get all of those products to zero carbon? It's a daunting, when we think about it and think about everything that's made, it seems pretty daunting. However, next. We see the same thing in industry that we see in the building sector. There are a handful of products that are responsible for 50% of all industry emissions, and then the millions and billions of other products responsible for the rest. Concrete and steel are responsible for half, just 2 products of all CO2 emissions in the industrial sector. Next. So we need to focus on that. First. That's what we need to do next. So the first thing we need to do is change the conversation. Everyone needs to be aware that those 2 materials are really leading CO2 emissions in the entire industrial sector, and we need to put pressure on them. Next. That is happening today. We see in mainstream media, concrete, the most destructive material on the planet. Next. Steel, next in the crosshairs as climate pressure grows. So the pressure of the media is growing, and all of a sudden next, the architecture community has rediscovered mass timber and cross-laminated timber and glue-laminated timber, and we can use them in high-rise buildings. This is giving concrete and steel heartburn, and it's an alternative. And once you have an alternative, then the other 2 materials need to get their emissions way down in order to compete. So mass timber is giving them a run for their money, and that's good news. Next. So can we meet the 1.5 degrees C carbon budget, that 340 gigatons? Next. Of course we can. Let me show you why. Next. We have 20 years to do it. This was Toronto in 1891. Next. This is Toronto roughly today. You can see all the new modern buildings, what we call modern buildings, high-rise buildings in the background, responsible for half of all the city's emissions. How did we go from one to the other? How long did it take to make that transformation? Next. Next. Well, we can see that the first modern building was in 1925. So this was the first modern building. Structure moved inside. You can see no more bearing walls. We had columns, big open floor space, and we could hang the exterior wall off the structure and make it essentially all glass. Next. That was in 1925. Next. So next, what was happening in 1925 was pretty primitive in a way. We had the Model T truck, we had radio vision, it wasn't until 1927 that we had the first transatlantic call. So things were pretty primitive back at that point. Next. And conditions, next, were really bad in Europe. And so the architects and planners of the world essentially got together and held the first Congress on Modern Architecture. They talked for new kind of building design, this modern architecture of the Bauhaus, and called for function-based zones, get the housing out of the industrial areas. People were dying of emphysema. The average lifespan was in the 30s, and they called for a whole new way of planning. Next. Next. You can see what was going on at that time, and then by the 30s, that style was then called, it came to New York City, called the international style. We can now heat, light, and cool any building. Fossil fuels were dirt cheap, and you can put the same building type anywhere in the world. Well, what was going on at that time? Well, it was still pretty primitive. We had the first transatlantic flight wasn't until 1935. By 39, we had the Johnson Wax building. The floor plan opened up. You can see the columns, beautiful floor space. Next, getting a lot of light into spaces. Next. And by 49, you see Philip Johnson put his glass house in New Canaan, Connecticut, single glass, a tour de force. We can climate control any building, even if it's a single glass building. By 52, we had the Lever House, which was then a high-rise single glass building, hanging the curtain wall on the structure. And by 56, we had whole cities then planned on modern principles. Next. That transformation from Bauhaus to Lever House, next, took exactly 27 years. Think about that. Next. And this is what we did it with. We did it with these primitive tools. At that point, in order to do a set of working drawings, it took a year or 2 years. We had to dip a pen into an inkwell and then draw. And if the ink got under the T-square or the triangle, we had to scrape it off with a razor blade. That's how long it took us to do drawings and to transform the world in 27 years. We have 20 years to do this now. You couldn't do a curve because you only had French curves. You couldn't dimension it. So there were no curved buildings back then. Next. We didn't even get the first ink pen until 1960, where we can draw with a pen, a straight line. And the laptop didn't come into 1991. So think about what we did in 27 years back then, what we can do in 20 years now with the tools we have now. Next. Not only that, solar energy is now the cheapest electricity in history in the world. It is cheaper than fossil fuels. Next. Battery power is coming down dramatically. And think about this. Look at where all the energy rich countries are, where all the construction is going to happen in Africa and in Latin America and Southeast Asia, India. These are energy rich countries. This is energy that's delivered free to every single site on the planet. You don't have to burn anything. You don't have to build anything. You don't have to pipe it. You don't have to do any of that. All you have to do is collect it and store it, and that is now cheaper than fossil fuels. Next. So we've developed a communique. We're going to take it to Glasgow. We're going to call on all countries to meet the 1.5 carbon budget because we know they can do it, and we're going to demonstrate how it's done next. As an illustration, we're going to take the U.S. success story. This is the U.S. building sector emissions from 2005, which is the benchmark that we set. Next. And this illustrates where we are now. We are in the building sector in terms of building operations in the entire United States, 30% below 2005 levels. If Biden is successful in getting to a zero emissions grid by 2035 and a few other policy changes, not very many, next, our building sector in the US, next, will drive down to 72% reduction by 2030, and we can easily hit zero emissions in the entire US building sector by 2040. If we can do it in the US with our archaic policies and how long it takes to get things done, this can be done anywhere, and we will demonstrate that when we go to Glasgow. Next. Thank you very much.
Thank you. Just phenomenal presentation. It all up. I would just want to say that today is also Yogi Berra's birthday, May 12th. You probably knew that, 1925. Born in St. Louis, not New York, and of course a Yankee, but he lived in New Jersey. He said, among other things, or reported to have said, the future ain't what it used to be. And that's through the efforts of the three of you. It's interesting to see the statistics that back up the optimism that I think you all share about cities, about the future of our planet. I think, to quote Clark Nightingale again, if you'll indulge me, statistics is the most important science in the whole world. For upon it depends the practical appreciation, application of every other science and of every art. It's the one science essential to all political and social administration, all education, all organization, based on our experience. For it only, it's the only one that gives the results of our experience. Seeing and interpolating from everything that the three of you presented, and Dr. Bassett, I remember your presentations during the Fit City conferences with similar statistics showing rates of obesity based on socioeconomic and patterns of settlement, patterns of residence. We're over time, which is regrettable because I was hoping we would have at least 15 minutes to bring the three of you together and share the ideas that complement each other, and also bring in questions and answers, questions from the audience, answers from you all. That, in fairness to the next two panels, won't happen quite now. So what I put in the chat room is that if there are questions, pressing questions that need answers, we can maybe address them in the chat room live and over the next hour and a half, or even subsequently through email if that's not too impolite. But I'd like to get to the second panel now, and then come back to general questions at the end if time permits. And I'll just remind the speakers, in fairness to everybody else who follows, we're striving for 10 minutes of presentation so that we'll have about 15 minutes for interactive discussion. Not hard and fast, nobody's going to be cut off. I hope people can stay if we have a few minutes after for Lance's summation. But without further ado, I'd like to introduce the second dialogue session, Science Matters, and the panelists who will be addressing that interrelated issue based on that segue from the esteemed Florence Nightingale. The first panelist is Dr. Robert Socolow, who's co-director of the Carbon Mitigation Initiative at Princeton, where he's professor emeritus in the Department of Mechanical and Aerospace Engineering. Previously, Robert was an assistant professor of physics at Yale University, and he joined the Princeton faculty in 1971 with the assignment of inventing interdisciplinary environmental research. No small task. Dr. Sokolow, the floor is yours.
Excuse me. Hello. So I have one slide which I hope can be shown for me and put on the screen. And I'll have it on the whole time. Is that, which I sent in yesterday, is that in fact in hand or it is not?
Not sure, but we will work on that while you start your talk.
Well,
And you have 10
well,
minutes.
or
And
I will,
we'll
or
have the
no,
slide
because
up
the
later.
alternative is that I show it, and maybe I show it for a couple of minutes. And it looks like
Okay.
this. So if you can put it on the screen, then I can talk more easily from my own notes, but decided that at 7 minutes or 10 minutes, the way I think about a city is in concentric circles of analysis, or for the sake of argument here, one of which is one could call the domain of industrial ecology, which is the impacts well beyond the city boundaries. The second of which is the city itself as the unit of analysis. The third in which it is the buildings, as we were talking so much today, the actual structures one at a time. And the fourth is the people within. Excuse me. So with this single slide, I hope to create some structure around the question, how does science inform the resilient city and sustainable urbanization? I've introduced the word conditionalities in the title of the talk because I want to spend, because I find the word conditionality very powerful, and it's used in international language in the United Nations and elsewhere. I think it's more general. Give me 1 second. Conditionality is what surrounds any societal objective. I'd like to accomplish goal X only if I improve Y and prevent Z. It defines what victory means. It is the package of X and Y and Z that is the victory. I work mostly in the field of climate change solutions. The Paris Accord, adopted by the nations of the world in December 2015, set a goal which caps the maximum average surface temperature that our planet is ever to reach in the future. It is a temperature that should be well below 2 degrees. We heard the discussion of 1.5 just a moment ago. 2 degrees centigrade, higher than what the Earth's temperature was at the end of the 18th century, at the beginning of the Industrial Revolution. The diplomats knew not to write down any conditionalities related to that goal in the Paris Accord, because so many constituencies would have asked for their conditionality to be recognized. There would have been thousands of them. Some would have added conditions related to biodiversity, others would have added conditions related to inequality, and so forth. In the case of climate change, the Paris goal is external to human society. The temperature of the planet can be measured accurately. When the goal is a sustainable or resilient city, however, the goal is not externally defined, and conditionality becomes the entire story. The city becomes sustainable only if it successfully addresses Y, and only provided it does not create Z. But what are Y and Z at each of my 4 levels? We'll start with the red outer circle. From the largest geographical perspective, a city is an importer and exporter of stuff from near and far, even from halfway around the world. The observer positions herself at the city's perimeter and chronicles everything that flows in and out. This kind of thinking is called industrial ecology. Anna Ramaswamy, my colleague who will speak in this panel, is a current leader in industrial ecology. I had something to do with the beginning of that field. Water flows into the city through pipes originating at above ground and below ground reservoirs, and sewage, treated and untreated, leaves in other pipes. Food comes in from farms with consequences at the farms. Fuels enter by truck and ship and pipeline, and carbon dioxide is generated when the fuel is burned. Electricity comes in on wires with consequences where the electricity is produced. Some of those consequences, like air pollution, meaningful for public health, adversely affecting public health hundreds of kilometers away. We badly need a more comprehensive understanding of the industrial ecology of cities, because materials flows into and out of cities increasingly dominate the total global materials flows, are receiving increasing attention from civil society, business, and governments. Industrial ecology drives us to identify conditionalities such as sustaining biodiversity while we produce food and protecting the Amazon rainforest, for example, and limiting greenhouse gas emissions. The second perspective, the green circle, is the perspective of an urban settlement with an approximate physical border. It's something like an SMSA, a standard metropolitan statistical area in the US parlance. It is a city governed with physical infrastructure partially planned and regulated. Here is where most urban professionals focus their work. Most of the people on this call, I suspect, operate in the green circle. What conditions would you place on sustainability before you would consider a city sustainable? You might invoke conditions involving crime and safety, involving the reliability of services, involving mobility and traffic, fairness and access to resources, the balance of public and private amenities, distributed governance and neighborhood autonomy, the interpenetration of parks and nature in general. We've talked about some of those. It is a very big menu, and it will determine the livability of cities. Perspective I worked on, particularly when I began my career in interdisciplinary environmental work, related to the individual building. We did field studies of energy use in buildings at a time when that was not a fashionable topic of inquiry. It could be an apartment block, a private home, a store, or an office building. There's an immense need in this domain for scientific thinking. Indoor spaces are heated and cooled, food is refrigerated and cooked, spaces are lit, cell phone batteries, and perhaps soon electric vehicles are charged. In that work half a century ago, we identified immense opportunities to accomplish the same tasks with fewer demands on physical resources. Today's light bulb is much more efficient, and many windows are much better. We don't herald those achievements, but they're very much part of the sustainable cities achievement. Most of the opportunities we found, however, are not ones that have been accomplished, but are still there. If I had one wish related to the sustainable city, it would be that the complexes of apartment buildings under construction in the cities of the industrialized world would become much more visible than they are today. What is really happening in those apartment complexes at all levels? They scarcely get mentioned. We don't see pictures of them when we talk about this topic. How could they be better spaces in physical and social terms? We're talking about 10,000, 25,000 people in a single new urban complex, typically outside the center. The city can't be sustainable if its buildings are built sloppily without regard for life cycle costs and for how they are used. The fourth level, the inner level, is where we're talking about the individual, his or her personal experiences and moods. We can have low carbon power plants powering mass transit and smart thermostats, but that doesn't count if the residents are miserable. My colleague Anu speaks of the livability of cities. To unpack that concept in so few minutes is beyond my capabilities, but my conditionalities would include feeling in control, feeling safe, feeling visible, and feeling that wherever I am societally, there is more room, there is more that I can aspire to. So thank you. Those are my thoughts.
Thank you, Robert. I think the conditions are acceptable. I think along with what Ed was describing and our general need for energy reduction, you covered all the bases. I'd like to bring to the floor next David Malakoff. David is Deputy News Editor at Science Magazine, where he specializes in coverage of science, policy, energy, and the environment. He has spent more than 25 years reporting on how scientists influence government policy and how government policy shapes science. Again, I'll remind you that full biographies are on the CSU website. David, the floor is yours.
Thanks, everybody. Thanks for involving me in this. I just want to start by noting that unlike my two other really distinguished panelists, I'm not an academic researcher and I do not have a PhD, but I am a journalist. And so what I want to offer today is a few words about what journalists, and particularly journalists like me who cover science and policy, can bring to the issue that we're talking about today, which is really the future of cities. The first thing I want to say is that journalists, and particularly science journalists, are really boundary spanners and synthesizers. Our job is often to go out into the world and find out what is going on in some really particular specialized corner of the world, such as a science lab or a regulatory agency, and then take that and translate it or explain it to some less specialized audience. So at our best, we kind of draw connections for our audiences and we synthesize information from disparate fields. And at our best, we really, our role is to help start conversations and inform those conversations about potentially important problems. So, during the pandemic, you could see that me and many of my colleagues wrote stories about research suggesting that there was a link between exposure to urban air pollution and increased vulnerability to really severe COVID-19 symptoms. And that vulnerability was sometimes exacerbated for poor people of color because of policies and practices that tended to clump those folks into more polluted neighborhoods. So if you think about that story, that's a story that actually has to synthesize work from a really vast array of research fields: basic epidemiology, economic research, housing policy, transportation policy, legal issues, just a huge number of issues in play there. Now, when you take on a story like that, though, journalists don't really view ourselves as teachers. A colleague of mine once said, if you want education, go sit in a classroom. What I produce is the stuff that gets used the next day to wrap a fish, right? Newspapers are kind of ephemeral, magazines are ephemeral. So we don't tend to write stories that sum up everything we know about a particular topic. We don't write textbooks or technical reviews. What we do is we write stories that are maybe 750 or 1,000 words or last for a few minutes. And really, our job is to tell our audience about something that is new or different. In a word, what is news? What's new? So when we think about stories as journalists, we tend to ask a couple of really fundamental questions. One of those is, so what? And another one is, who cares, right? Who cares about my story? Would my audience care about this story? Does the issue affect their lives? Could it affect their children's lives? Now, the good news for you guys who work on urban issues, and thank you for that, is that when it comes to thinking about the future of cities, I think we can assume that our audiences are pretty interested. For one thing, most of our readers and listeners and watchers all live in cities, and people tend to care deeply about the places they live. And even if they don't live in a city, they often rely on a nearby urban area for their livelihoods. So one message I really want to leave with all of you is that if you work on urban issues, and if you're interested in drawing the attention of journalists to your work or to some issue that you think is important, you have an access point. People care about cities because they live in them or rely on them. So that's one thing. Now, having said that, I really do not want to understate the difficulty of persuading editors to commission stories about cities or getting journalists to write about them. And that's because the issues are often pretty complex and pretty dry. Building codes, zoning battles, construction finance, transportation infrastructure, energy systems, some really complex modeling. I think you get the idea. A colleague of mine likes to say that there are important stories and that there are interesting stories, and they often are not the same. So, journalists, my challenge is to take an important topic, the future of cities, the sustainability of cities, and turn it into an interesting story that you will capture your attention. And in my case, there has to be a science angle because I work at Science Magazine, or a research angle. So one thing I do is I invite you, all of you out there, to help me. Send me tips about new and interesting developments in your fields or your work. Or if I call you, help me understand new findings and put them in context. And every journalist will make the same request of you. Now, if you could throw my slides up, I hope that's not a problem. I just want to finish out my remarks by offering a couple of examples of how journalists have approached urban issues, and also some thoughts about the kinds of stories that I would like to see more of, and some stories that I would like to see a lot less of. So I'm hoping we can get my slides up.
I hope so too.
There, I think looks like we're coming close.
David, while we're waiting for them, I would like to say that being new to academia myself, at least on the other side of the line from being a student, the same questions pertain. The so what and
Yes.
who cares are fundamental to academic research. Also, who's paying for it?
Yes.
And then who's listening
Yep.
ultimately.
Right.
Could you
Well,
share your
let's
own
see.
screen? Is that possible? Oh, here we go. Great. There we go.
Yeah.
Thank you,
Yeah.
Saba.
Thanks, Saba. Okay. So I want to start, I'll start by touting some of my own work. About 5 years ago, I was one of several editors that planned this special issue of Science called Urban Planet that focused purely on cities. It was a huge range of articles by scientists and articles by journalists. Next slide, please. One of the ways journalists can tell powerful stories is by using graphics. And this one that we did pulled together a huge range of information. So for example, those orange dots sort of tell the story of the growth of urbanization around the world, the growth of megacities. But we also did some other things. If you look over on the right, which you can't see, but I'll just tell you what those two little graphs show you. What those two graphs show you is that as urbanization grows, water quality declines rapidly. As you get more hardened surfaces around cities, water quality just falls off a cliff and lakes and streams die. So the point here is we're trying to draw connections between disparate areas and show the consequences of urbanization, or an issue you might not have thought about. Next slide, please. We also sent a reporter to a favela in Brazil to look at a little known but emerging problem, which is how rats, which are the single most common form of urban wildlife, are now spreading a disease that used to be fairly rare in many megacities and many places around the world, even in the United States. Next slide, please. And again, this story tried to look at the complex interplay of issues. So in this case, one of the stories within this story was how public health workers had to go into this favela to work, but it turns out there were drug cartels in this favela that were in a battle with each other. And so it made life extremely dangerous for these health workers. So there's an issue you have to think about if you're thinking about public health often in some of these urbanizing areas. Next slide, please. And of course, you can't ignore China when you're talking about urbanization. So we did a piece about how China is, thinking about the lessons it's learned from building cities. Next slide. We also had some fun thinking about technologies that might change how cities are built. So this was referred to earlier, using wood to build skyscrapers. Next slide. So writing about wooden skyscrapers is fun, but the fact is they don't really address the big issues that are confronting cities right now. So one fair criticism of my own profession is that we spend way too much time focusing on the rare or the unusual or the counterintuitive example, right? So every week we get a story like this. The flying car is here. It's going to change the world. Really? Flying cars are going to change the world? It's sexy. It's interesting. But let's be real. This is not an important story. Next, please. So here's an example of the kinds of stories I would like to see more of. This is a really interesting read about all of the issues that contribute to gridlock in various cities, including climate policy, electrification of vehicles, housing and planning decisions. This is, difficult work, again, synthetic work that's really good. Next story, please. And who doesn't want to read about traffic? People hate sitting in traffic. Here's another one. How climate change could spark the next home mortgage disaster. Again, drawing connections between what seem to be disparate issues. Next slide. Climate change related lawsuit nixes huge California development. Again, who knew that zoning decisions and climate change are increasingly being linked? Really important issue told in an entertaining way. Next slide. Good story here from John Upton at Climate Central, looking at inequality and the federal response to severe weather. Again, important issue in many cities. If you lived in Atlantic City, you're going to read this story. Next slide. And finally, I just want to commend to you work by this group Circle of Blue, which is a nonprofit which focuses purely on water issues. Next slide, please. And one of the things they've taken on is a huge series of stories looking at the connections between water and urbanization. There are dozens of stories. They went all over the world. Fascinating issues, fascinating stories. So I encourage you to check that out sometime. So, and just to close, I want to invite you to think about a story that you would be interested in reading about the future of cities. And then I want to urge you to reach out to a journalist or an editor, maybe at a local paper or a local TV station or your journal, and suggest it. And I say that because journalists are always looking for ideas. We are always looking for ideas, and you folks are our best sources. That's where we get ideas. Thanks a lot.
Thank you, David. I was also enjoying reading the articles. They flashed by way too quickly. The one with the pictures of the cars on the freeway in LA was actually about LA Transit, reading the first paragraph, introducing new bus rapid transit lanes on April 1st. So I hope that wasn't an April Fool's Day joke and that was real.
Right. Well,
because
it's actually
made
about
such a
how,
transformational difference.
yeah, but it's interesting. It's also about how opposition to those BRT lanes was a big issue, a big problem that the city had to deal with.
Yep, and they're doing much more transit as well. 28 new stations by 2028 to expand the rail capacity as well. I'd like to move along though to have the third speaker of a three panelist series. Dr. Anu Ramaswamy is professor of civil and environmental engineering at Princeton University's Institute for International and Regional Studies and the High Meadows Environmental Institute. She is an interdisciplinary environmental engineer recognized as a pioneer and leader on the topic of sustainable urban infrastructure systems. Dr. Ramaswamy, the floor is yours.
Thank you so much. Can you hear me? I'm going to share a quick PowerPoint that I'd like to walk through. And as I load that, I just wanted to say I'm so delighted to be part of this panel and really appreciate all the speakers that came before me. Could you see my slide? Wonderful. Okay. So I'm going to talk about this idea at the nexus of the pandemic, our health challenges, and the climate challenge. So what are opportunities for cities and for policymakers at this intersection between pandemic resilience, sustainability writ large, and equity? And is there such a thing as a post-COVID city? And how might we think of these things? I want to maybe share a little bit about my my research lab. I also, as I was introduced, I'm an interdisciplinary environmental engineer, housed in civil and environmental engineering, also appointed in the Princeton Environmental Institute, and I direct the Chadha Center for Global India. One of the NSF grants I direct is called Sustainable Healthy Cities Network. And through the past 6 or 7 years of that network, we think of cities as these multi-sector systems. You can see these key provisioning systems: buildings, energy, food, green infrastructure, mobility, water, and waste. They shape all of these outcomes. And so when we think about well-being, and thank you for Rob to highlight my work on livability. When we think of well-being and livability, it's more than physical health. So mental well-being is important. Urban environments are important in that context. So is our impact on the planet, which is indeed transboundary. Issues of equity, and they all come together in this notion of livability. And so what the pandemic has shown is that the outcomes are interconnected. It's not only about disease. So as the waves of the pandemic come and go, you see people struggling with issues of mental well-being, social isolation, economic hardships. And you also see these sectors playing together. You see food systems, you see mobility systems. It was a wonderful keynote where Dr. Jha talked about wastewater-based epidemiology. And so if we want to think of the future city, the idea is we have to think of these multiple physical systems, their connection with social systems, and these outcomes, because these outcomes are interrelated. So I thought I'd speak a little bit about a white paper, and I just wanted to say it's a draft paper that we're developing. It's actually almost done. And this has been done with collaborators both within academia as well as in practice. So Angie Fife and Ashish Jha are with Exley, which is a network of cities. And our goal was actually to interview cities across US and India to really learn about what pandemic resilience even means to them. And then to extract some science-based conclusions. Now in 10 minutes, I can't go through all of it, but I wanted to say that we've organized our thoughts in terms of synthesis. So there are 10 learnings that we synthesize, not only from these interviews, but from news articles and so forth. And what I wanted to say was that we've organized this in 3 steps to build back better. The first step emphasized in the health panel was we really do need health risk sensing systems for current and ongoing risks. We should also think about what helped cities function. So beyond the pandemic, cities still had to function. What enabled the functioning of cities? What were barriers to that functioning? And then can we look to the long term on what are the intersections between this pandemic resilient opportunities and opportunities to get us to 1.5 degrees. So that's the idea of this paper. And it's grounded on data science innovations. We can't do these 3 things without data science innovations, without people, policy, and governance, using a systems lens. And again, thanks to Rob Sokola for giving me a shout out. A lot of what my lab does is talk about integrated transboundary social, ecological, infrastructural urban systems. So in other words, a city as a bounded object really doesn't work for these types of big challenges, and looking at them as a combination of social networks, infrastructure networks, networks that span boundaries is really important. So I thought I'll just talk about the 10 learnings, and someone said, is the paper available? We're hoping to put this, at least submit it in the next week or 2. But let me talk about the first box, and I'll talk about each of them. But the first one, we talked about health risk sensing. And the first thing I wanted to say, very similar to Dr. Jha's presentation, is there's just been an explosion of work on how cities can sense, either using wastewater epidemiology or other types of methods, sense and model different types of risks. And here we're talking about infectious disease. But our second learning is that those comorbidities are so connected with chronic health risks in cities. We talked about air pollution, but you could also look at nutrition, obesity. And so the second learning is that, the non-communicable risks are as important. So as we think about the future, we want to think about both of them together. A third idea here is that health is more than just disease. Health is also about well-being. And so how do we think of well-being beyond thinking about disease? And so this is where ideas of subjective well-being, livability come in. And when you think about people responding to the pandemic, it's not all about health. It is also about well-being. And lastly, inequalities are of course seen, but what was striking from our interviews with all the cities was that traditional ways of thinking about inequality weren't really effective. In other words, if we had traditional measures of poverty, asset-based measures, those didn't really capture the types of inequality that were seen during the pandemic. And so those were sort of the 4 key themes emerging in the first topic of how do we think of health in a broader context. Then we interviewed cities on the adaptive functioning, what really helped. And the first thing that emerged was that there were different types of risks. There were risks to functioning. The most obvious ones were closed services, right? So many cities had to close transit, or they reduced mobility. Some of them reduced park access. But other cities also struggled with supply chain issues early on. Another struggle was the shifting demand. So what would happen when household energy use increased and commercial energy use decreased? What happened when waste pickup changed because people had to focus on household waste much more? And so that was interesting to see how cities responded to shifting, just the nature of shifting services. And then lastly, the big theme that came out of here was compounded risks, that in city after city, pandemic-related threats were compounded. In Minneapolis, it was by some of the issues that came out around race, and the cities were shut down. It was wildfires in California. They were in India, it was cyclones. And so how do cities really think about functioning when they have pandemic risks compounded with other risks came up in these adaptive strategies? A lot of success came out from ideas of flexibility. So how can we build flexibility? The second big idea was substitutability. When can you substitute one service for another? A third big idea, of course, was partnerships and buffering capacity. So how do city governments create buffering capacity? And some examples were even in financing. How do you create buffers when you have, something like a long-lasting pandemic going on? And then we moved to the long term, and we said, well, what can we do at the long-term transitions at the intersection of sustainability, health, resilience, and equity? And I think this is probably the funnest part in this workshop, is the big topics that came out were, the combination of housing, mobility, and digital technology. And here the idea is that the story may not be so optimistic. We all thought in the beginning of the pandemic, in India, you can see the Himalayas because of the shutdown, that air quality improved and people would somehow become more sustainable. But there might be at least initial data showing that in many cities, traffic is back to 80 or 90% to what it used to be. Traffic patterns have changed. People might be moving outside, traveling more. And I think this is an area where you really need urgently to focus on better data to understand this linkage between digital technologies, housing, mobility, and sustainability. A second area for thinking long-term is, of course, the food system, because systemically, you could almost think urban expansion into agricultural areas is actually what releases or promotes the spread of zoonotic diseases. And so this could be food systems, and thinking of food systems broadly is important, both from a pandemic perspective, but also equity and sustainability. And then last, we talked about wastewater. So thinking about what the millions of people on the planet who don't have access to sanitation, can we sort of leapfrog and think of sanitation systems in those parts of the world that can be redesigned for energy as well as for health and sustainability? So those were my takeaways, and I just wanted to say that if you'd like more information, please email me or visit our website, my lab's website. Thank you.
Thank you. Thank you, Anu. Thank you all for excellent presentations. They're clearly interconnected. It looks like you might have had a chance to speak a little bit beforehand. I see the relation of both the conditionalities, the concepts about how we adapt and what are the problems, to how we can build a post-COVID city. What are the changes? How do they affect the interconnected issues, Dr. Ramaswamy, that you spoke about, including mental well-being and economic vitality? What are the fundamental questions? Speaking of which, I've been monitoring the chat room, and there's a lot of vibrant discussion, both about timber construction and racism, as well as political agendas. Thank you, Yanis. It's a good segue perhaps to the third panel on government matters, on governance, on community, as at least one person has called it. But apart from whether journalists, or for that matter, academics, have political agendas, do politicians have scientific agendas? Is science used to shape national policy or urban policy? And if there's a single question that I'd like to ask all three of you is, as we segue into the third panel, your thoughts about the interconnection, perhaps, of your work in science, and that's not technology, although it brushes against it, and policymaking and politics, and the expression of public sentiment when it's often divided on matters of science, when there are, what shall we call them, science deniers out there, maybe not in this room, but certainly in other rooms not far away. Last thoughts from either or either all of the three panelists before we move on.
I can speak a little bit about this. Almost all of my work in cities is policy initiated or policy driven. And in fact, I began working on sustainable cities by working on greenhouse gas accounting with the city of Denver, which stimulated new science. So I just wanted to emphasize this idea of knowledge co-production, that the science, having policy relevant questions inform your science, not only creates new science, it also creates science that's actionable. And we can talk another time, but this is very doable. It does take effort, but in my opinion, it improves the science, and I hope it improves the policy. The second thing I wanted to say is that it takes trusted relationships over several years. And so having those trusted relationships, in my case with city policymakers, again, takes a lot of time that academia, I think, doesn't quite recognize, but we do it out of our interest. But I also think, again, that long investment on both sides, from the city partnerships and from the researchers, is crucial. And the last thing I would say is, I think we do need to respect diversity of opinion. So it is true where you could say this, I just think thinking about where people come from as we think about science deniers or non-deniers, I just think creating open spaces for that discussion can be quite helpful. Thank you.
I think the one comment I would make in the interplay in science and policy, beyond the usual comment that science can inform policy, it can't make policy, because policy in the end is essentially, it's a process of mediating disagreements among groups to arrive at some consensus way to move forward. So, the example I always give is we can all agree that carbon dioxide is building up in the atmosphere. That finding does not tell you whether a carbon tax, a cap and trade system, or simply doing nothing is the right policy approach. It can tell you the consequences, perhaps, of each of those approaches, but it can't decide for you which one of those you should take. And finally, I would just say, I agree, co-production is really interesting. And I think one of the things that would help co-production is if researchers once and for all bury the deficit model, which is this idea that if you simply knew the facts that I know, you are going to think exactly the way I think, which, decades of social science research has shown is not true. And the COVID epidemic is showing in extreme fashion that simply giving people the facts does not necessarily mean they're going to think the same way you do. So we all need to take that into account.
Robert Lessword, you're muted. Please unmute. We can't hear you, Rob.
I'm sorry. Something that intrigues me that we need to communicate to the public as much as we can is that science is an evolving system. We always only understand partially. One of the things that dismays me is that climate change as a problem, people say if you discuss the fact that we don't know everything about the planet, we will get less action than if we pretend that we do understand the planet perfectly. It should go the other way, because we do not know we cannot rule out really bad outcomes that are not high probability, so-called high tails of the distribution of what could happen. They motivate action as much as the average does. We need to have a greater priority to doing climate science and understanding how the planet works. And realize what we're dealing with in that instance is risk management. In many of the public health areas, it's the same story. We're not quite sure how severe something is going to be. We act upon it anyway. There's room for citizen science. I call particular attention to the residential buildings of the developing world that come in these very large complexes. How come that's invisible when it has such a large impact? And then we shouldn't expect any of our solutions to be risk-free themselves. The science around solutions, whether it's solar, biofuels, or whatever, it's always a story of something that's less than perfect. It's got its own problems, and it's got issues you want to watch out for, so you don't get something, you wish for something and then sorry you get it. Be wide awake. Science can help in that regard.
Thank you. All excellent points and a good segue to our third panel about decision makers in government who rely on scientists and others to form policy. The last May 12th birthday that I'll invoke in making the introduction is that of Dante Gabriele Rossetti, who of course was born on May 12th in 1828. In The House of Life, The Choice, he wrote, "Eat thou and drink. Tomorrow thou shalt die. Truly, the earth that's wise, being very old, needs not our help." I would disagree with that, and I would say that the earth very much needs our help and the help of people who have been elected or appointed to high office. We have three such people following, and it's now my honor to introduce the third dialogue session, Government Matters. The panelists discussing the relation of government to resilient cities after COVID-19. We'll start with His Worship, Barry Vernovic, is the mayor of Kitchener, Canada, having been elected in the 2014 municipal election. He also serves as co-president of the United Cities and Local Governments, an umbrella international organization for cities, local and regional governments concerned with representing and defending the interest of local governments on the world stage. And forgive me for butchering your name, Barry, if I might, Your Worship.
That's exactly the way I like to be called, and thank you very much, Rick. If I can call you that as well, and thank you so much, esteemed excellencies, fellow speakers, ladies and gentlemen. It's a real delight to join you this afternoon for this very important and enlightening discussion at such a critical time for cities and communities around the world, and with such a dynamic group of colleagues who have brought forward many interesting perspectives. I was especially pleased to see that earlier on, fellow Canadians like Patricia Carney, the CEO of the World Council on City Data, was participating. And I only mentioned Patricia in particular because one of the things that the past 14 months have shown cities, whether we talk about health and social impacts, whether we talk about economic impacts, environmental ones, or the impact on our arts and culture sector, data, and particularly good, accurate, and timely data, has proven to be more critical than ever as we tackle the quickly changing environments in our cities and communities during the COVID-19 pandemic. For those of you who don't know much about Kitchener, with a population of 260,000 people, we're 100 kilometers west of Toronto, Canada's largest city, and one of 7 communities within the region of Waterloo that, with its population over 600,000 people, makes us Canada's 10th largest urban region. We are on the western end of the Toronto-Waterloo Innovation Corridor, one of the world's largest technology clusters, second only to Silicon Valley. And our region has been home to BlackBerry, Google's Canadian engineering headquarters, and the University of Waterloo. And yet, despite all of these urban things, we also see our rural Mennonite community live a simple life where they still ride their horse and buggies into the city as they conduct business. As the prelude to this section has indicated, leadership during a time of crisis has been crucial in putting the common good ahead of individual gain and as a prerequisite for cities to stay vibrant, economically sustainable, and relevant. Whether I speak with my mayoral colleagues in Canada through the Federation of Canadian Municipalities or the world's mayors through United Cities and Local Governments, over the past 14 months, our collective energies have been drained as we looked to not only tackle the very real challenges that were being brought on by COVID-19 in our municipalities, while also working to move forward on some of the longer term strategic initiatives that we identified at the start of this political mandate prior to the commencement of the pandemic. In mentioning both FCM and UCLG, I'd also be remiss if I did not mention the important role that these associations of local governments played in bringing mayors and cities together during this past year, along with others such as the Bloomberg Foundation, to ensure that mayors and cities had the advocacy, tools, and supports needed to tackle the challenges which were thrown upon us. For cities of all sizes around the world like Kitchener, the primary area of leadership focus has been around addressing the healthcare needs of our residents throughout the COVID-19 pandemic. What has been different in each jurisdiction is what direct role did cities have, and in what instances did they have to play more of a coordination or an advocacy role. What has been the same is the need for governments to set political ideologies aside and to work together as they have never worked before in order to tackle the challenges posed by the war against COVID-19. In Kitchener's case, that has meant working with the federal, provincial, and regional governments in a highly collaborative manner. As we await the day when we will look at COVID-19 in our rearview mirror and review the lessons learned from the pandemic, we will see that jurisdictions that were able to be most collaborative and where governments made strong decisions governed by science and data will have been the most successful in outcomes both during and coming out of the pandemic. As we reflect on this in the context of sustainable communities, we need to examine the social, economic, environmental, and cultural impacts of the pandemic on our communities, and we certainly need to reflect on all of this against the UN's 17 Sustainable Development Goals and how as cities and communities, we use those goals to guide our work coming out of this pandemic to localize those goals during the remaining years of our collective decade of action. In reflecting on the social aspects of the pandemic, we were not very long into the pandemic before issues of equity came to the forefront, and we realized that those who were most challenged by the pandemic were in fact those who were disadvantaged from a socioeconomic perspective, and in particular those who came from our Indigenous, Black, and persons of color communities. Some of the things that we needed to think about early on included a reimagination of our homeless shelter system to provide for distancing, food security, and supports of the residents being served, providing access to communication in various languages to ensure all residents were getting necessary information, and responding to the impact of non-pandemic issues, such as the rise of the Black Lives Matter movement around the world that resulted from the murder of George Floyd and forced governments to increase efforts in tackling long overdue social injustices. As we come out of the pandemic, we must make permanent, long-standing improvements in our housing systems that not only meet the needs of our homeless, but also the wraparound supports needed to address addictions, mental health, and other challenges faced by many. We must begin to upset the apple cart and make meaningful progress against racism and challenges experienced by our Indigenous, Black, and people of color communities. As we move into the economic realities coming out of the pandemic, there's no doubt that the COVID-19 has brought about issues that we'll be dealing with for many decades. In many countries, jurisdictions stepped up to support their citizens and businesses most impacted by the pandemic with financial supports. In other places, that was not the case, and as such, the socioeconomic divide only grew. In the midst of the pandemic, we were slated to bring forward a new economic development strategy here in Kitchener. The pandemic forced us to pause, to rethink that strategy, to ensure we also used some of the investments and tools that we were making to ensure we best support our businesses both during and post-pandemic. In that regard, as an example, just last month, we launched a $5 million economic recovery plan that, together with investments made by our provincial and federal governments, will allow us to unleash our community spirit and spending power as we first come out of the pandemic, while also using this as an opportunity to accelerate a new wave of entrepreneurship and innovation that we know often follows a major global event like what we've just been through. From looking at investing in downtown outdoor patios to the development of food, retail, and service incubation programs, this is exactly the kind of innovation, especially when leveraged with investments from nation states and regional governments, can help ensure the positive transformational results coming out of the pandemic. Third, on the environmental front, we came to realize how we can make positive impacts on things like sustainability and climate change. COVID-19 gave Mother Nature a break, and we could see the impact of reduced greenhouse gases when we allowed the earth to breathe again during our collective lockdowns. We also came to appreciate ever more the important things like our parks and trail systems, open spaces, and a need to rethink the intensity of developments as we go forward and look at how our cities develop better in the future. Lastly, I'd be remiss if I didn't briefly touch on our arts and culture sector, which has been one of the most impacted sectors by the pandemic. The inability to gather has had a significant impact on this sector, and yet we know that arts and culture is so critical to the life of any community and its people. Culture and its live performances through paintings, music, dance, and other performances often speaks to the history of a people, its challenges, and its hopes and dreams for the future. As we look to ensure our cities return to being great places to live, we must ensure that our arts and culture sector is supported and returns to be even stronger than before the pandemic. Going forward overall, we are seeing some longer-term shifts. First, we've noticed that the real estate market has shifted over the past number of months. We're seeing people in our area move out of the larger cities and moving into mid-sized cities like Kitchener and elsewhere. Basically, if people have good internet service and are working from home, and that becomes the way of the future, then early indications are that people may not need to actually live in our largest cities, and we have to ask, how does that impact the development of mid-sized cities like ours? Secondly, we may end up having a lot of vacant office space in the future due to work from home policies. If companies cut back their space requirements, that may create a huge hole in our downtown and office areas, which could impact things like property tax assessments or businesses like restaurants rely on traffic from packed office towers. So shifting strategies on office space are still unknown and something we're going to need to monitor. Thirdly, we've seen some changes from a human impact perspective, maybe good, maybe bad. Like most of us have been doing for the past several months, and just like today, we meet with people over a video conference call. Screen time can be great in some ways. It cuts down costs and keeps us distant and safe. But we know there's a human element to meeting people. To be able to speak face to face, to be able to network, to be able to get past the discussion of business, and to have the in-person interactions that create and build relationships. People need those interactions, and that aspect can't be lost in any planning in the future. And linked to that, we know that COVID-19, one of its biggest impacts has been on our mental health. We are seeing significant impacts in our communities already. More are reported in the lasting impacts for those who have actually lived through COVID-19. And so going forward, we're going to need to invest significantly in this area by all orders of government to tackle these challenges. All in all, cities and communities as the order of government closest to our citizens have stepped up and weathered this unprecedented challenge. But COVID-19 has impacted us in profound ways that we'll be dealing with for years and decades to come. Will we return to old habits, or will we build back better? That is the challenge that's on all of us. Thank you very much.
Thank you, Mr. Mayor. All extremely important challenges that I think pertain to every city, no matter what size and no matter what country we're located in. We'll come back to the interconnection in a moment. I'd like to introduce our next speaker, Ashish Jha, who's Senior Advisor and Steering Committee member at the Global Water Challenge of the New World Program. She previously served as Regional Director for Africa at UN Habitat and also as UN Habitat's Director of the Global Division and Director of the New York office. Ashish, the floor is yours.
Thank you very much. Can you hear me?
Yes, thank you.
Excellencies, distinguished participants, ladies and gentlemen. Let me start by emphasizing that we are in the beginning of a new era, where the majority of the world's population is living in urban areas, and this continues to grow. At the end of the 20th century, there were at least 250 cities with more than 1 million inhabitants. 2 world wars, many smaller regional conflicts, genocide, and the ugly resurgence of intolerance, isolationism, racism, ethnic conflict are all elements that distinguished the 20th century, if I may say so. But history is also repeating itself, and we see all this, including in my own country, Ethiopia, today. The 21st century will be known as the century of the city. During this century, the urban geography of the world will drastically change with new regional urban systems such as mega regions, urban corridors, and city regions. Cities concentrate opportunities, jobs, and services, but also concentrate risks and hazards for health. In the developing world, urban growth has outpaced the ability of governments to build essential infrastructure, and 1 in 3 urban dwellers live in slums, and majority of them are women. Women cannot be safe in cities where there is no security of tenure, where there is crime and violence, and where there is human and natural disaster. I don't need to give you the data to shorten the time. Cities and towns in the developing world are already facing serious challenges, which include unemployment, especially among the youth, high percentage of people living in slums, dominance of informal sector, inadequate urban services, especially water, sanitation, health services, and energy, unplanned peri-urban expansion, social and political conflict, high levels of vulnerability to natural disasters, and poor mobility systems, among others. COVID-19 pandemic has laid bare and heightened humanity's most pressing challenges. It has also served to reset and redefine how societies are going about their business. In particular, the current crisis has demonstrated the decisive, potentially agile role of urban areas in the battle for just and green recovery. The pandemic has shown that well-developed, healthy infrastructure, while essential, is not in itself a guarantee of an effective emergency response. Some countries already had significant health infrastructure in place for the pandemic, but still lacked the relevant capabilities and knowledge to achieve positive results. On the other hand, countries that had experienced previous crises like Ebola, SARS, avian flu, and built strong institutions, systems, and processes, as a result, were generally able to respond to COVID-19 pandemic more efficiently and effectively. Crucially, the most successful government strategies typically combined solid, adequately funded public health systems and specialized infrastructures with community engagement and clear, transparent information and messaging. Cities that are open, communicative, and participatory tend to secure popular support more easily, strengthening the resilience of societies and their willingness to fight together for a common good. Misinformation, uncertainty, or lack of clarity, on the other hand, as well as the use of arbitrary or abusive extraordinary powers, only serve to generate distrust and resistance to government policies, thereby undermining the effectiveness of any response. It is clear that preparedness and responses to the pandemic mostly rely on the direction and support provided by national governments, as well as the strengths of urban economy, institutional capacity, political will, and other locally determined factors. However, how cities track, cope, react, and respond to the crisis is also crucial for the health and economic well-being of their regions, towns, interlinked rural hinterlands surrounding them. The local response also sets some scene for future resilience and sustainable recovery. Multi-level governance, i.e. governments and sectoral authorities with an integrated and coordinated strategy that also includes municipal associations, health professionals, academics, NGOs, communities, is key to addressing pandemic and implementing a meaningful recovery. In some countries, failure of national leaders to respond quickly has reinforced the influence of subnational governments. In some cases, cities took the initiative in the immediate response to the threat posed by the health emergency. Other cities received additional powers that had been voluntarily transferred from national to subnational levels of government to address the crisis at the local level. In other countries, however, the national governments took the lead, re-centralizing some powers from subnational governments in certain instances, or acquiring extraordinary powers by declaring a state of emergency. The downscaling of public sector in some countries appears to have left them more vulnerable to managing pandemics, as well as pressing challenges such as inequality and climate change. In some cases, pandemic has simply accelerated a protracted governance crisis that has been years or decades in the making. Revitalizing and enhancing this increasingly complex governance systems will be crucial to ensuring global security and prosperity. In order to reduce vulnerability of the governance system of cities, cities have to incorporate territorial and spatial governance approaches into national, subnational, and local pandemic responses. 2, promote an integrated and cooperative approach between different levels of governance. 3, promote an integrated and cooperative approach between different levels of governance. 4, ensure emergency preparedness is effectively integrated into health governance at all levels. And 5, encourage an effective, responsive, and capable public sector to meet needs, build resilience, and manage crises as they evolve. 6, enhance public engagement by strengthening democratic decision-making structures. 7, promote participatory budgeting, transparency, and trust building to maximize public support and compliance. 8, encourage community participation in the process is key and should be tailored to take into account gender, ethnicity, class, and other factors to ensure all sections of society are recognized and engaged. 9, exploit the opportunities that digital technologies offer for improved governance but alongside a clear commitment to equitable access and human rights. The pandemic has highlighted the value of online platforms and applications for information and service provision. However, it is essential that access is extended to ensure everyone can enjoy these benefits. In addition, appropriate protections around privacy and freedom must be put in place to prevent misuse by authorities. And ensure crisis management strategies incorporate long-term recovery strategies that align with aspirational goals around social inclusion and sustainability. The current crisis offers a unique opportunity to rethink the future and plan effective policies to address challenges such as climate change, inequality, migration, and the erosion of human rights. The need to achieve collective action, corporate solidarity to build back better, repairing the social fabric while transitioning to a more sustainable future is now clearer than ever. Adopt a global focus to rebuilding that recognizes the need for all countries and cities to be included in any lasting recovery. Though nowhere has been untouched by the pandemic, the impacts could be especially acute in some developing countries, potentially leaving them in a protracted state of crisis. Consequently, richer countries, international agencies, and other actors have a duty to provide appropriate technical support, financial assistance, and experience sharing as the world navigates a path to recovery together. Ladies and gentlemen, history has taught us that peace should never be taken for granted. It requires the active engagement of individuals, enlightened leadership, and powerful values. Acting on urban health inequities requires the involvement of organized communities and all levels of government, local, regional, provincial, and national. Solutions often lie beyond health sector and require the encouragement and engagement of many different sectors of government and society. Local leaders and governments can and should play a key role in promoting the urban health equity. It is important we make our dream of wonderful urban future of well-planned, well-managed, and sustainable cities a reality. The means to bridge the urban divide are not lacking. We must, however, muster the political will, good urban governance to make our cities fit for their citizens, men, women, and children, in an inclusive and equitable manner, and time to act is now. We believe strongly that we can achieve this through strengthened partnership with all relevant stakeholders and the promotion of a fruitful dialogue, including South-South cooperation. Let us work together to create an environmentally sustainable, economically productive, and socially inclusive urban future. The city is not only a space where structures are placed and where life is lived. Indeed, the city is a vibrant and powerful force for development, and that it exerts a tremendous impact on well-being at the global, regional, national, and local levels. Its benefits should not be confined largely to privileged social groups and special areas, as it is observed now, but to all citizens in an inclusive manner. Thank you very much for your attention.
Thank you, Exley, for those great observations. I think you could interpolate to say that cities should not be taken for granted either, and that the 21st century was inclusively the century of all cities, not just London and Paris or New York for that matter. Our last speaker in this panel, before concluding remarks by Lance J. Brown, is His Excellency Michael Mlynar, is the permanent representative of Slovakia to the UN. Ambassador Mlynar previously served as Director General of the Division for International Organizations and Development Cooperation of the Ministry of Foreign and European Affairs of the Slovak Republic and served as Ambassador to Kenya. Ambassador, the floor is yours.
Thanks very much, dear Rick, and sincere greetings to all. It's been really a fascinating morning, which turned into afternoon already. And I have to confess, this is the fourth statement that I am delivering this morning or early afternoon. But this is the most exciting moment for me to do that. I was very happy to hear a lot of previous speakers in this panel, but in the other ones as well. And also, I have been following a bit the chat, the discussions there. And it's great to see that these conversations are rich as ever, and really happy to be part of this conversation. As Mayor has mentioned previously, this is really an important context for us now to have a fresh look at many important developments, and I'm the one who hopefully is able to pronounce the mayor's last name Verbanovic well enough, because as you can imagine, it's of Slavic origin, like mine. Cities are really at the center of the pandemic, as they have always been during many previous difficult or challenging situations as well. And we had a chance to see it in our own eyes. And of course, the situation continues still being very challenging in many parts of our planet and in many cities. We should not lose sight of those more vulnerable or those who live in more challenging conditions that we may now in our cities, in this country, or in Europe and in other parts of the so-called Western world. Well, of course, here we have seen empty subways, vacant streets, closed restaurants, or no traffic jams. But in many other cities in the world, the situation was more serious due to challenges in infrastructure, challenges in the health sector, and these are just to mention the most obvious ones. And I can openly confess that we were experiencing a very challenging situation also in my home country, Slovakia, especially when it comes to the capacities of the health sector and to the ability of the health sector to be able to respond to the pandemic in an efficient and timely manner. But we are all learning lessons, and certainly this is one of them. But going back to cities, again, looking at the experience of my own country during the pandemic, cities or local authorities have often been at the forefront and in the leading role, also as regards organizing the response, organizing vaccination campaigns, and other important action. Of course, the the national or the central government is always the one that takes the primary lead, and of course that has to provide financing in particular. But without the cities and the local governments, as we all know, very little would have been possible, and we continue seeing it day by day also back home in Slovakia. So it is really an understatement when I say that cities have been on the front line of the response to the COVID-19 crisis. They play a key role to implement nationwide measures, but also provide labs for bottom-up and innovative recovery strategies. They have accelerated the response, as I have already mentioned. But the COVID situation clearly also has accelerated the shift towards a new urban paradigm, if you will, towards hopefully more inclusive, more green, and also smarter cities. Sooner or later, we will have to look back and analyze the lessons learned even more. Maybe it's still a bit too early for that, but it may be also the CSU itself that will facilitate further discussions on the lessons learned. I would like to briefly highlight but a few points that, from my perspective, are important to consider for the future, because we may be facing similar situations, just to say the least, but also we need to learn for a lot of other important developments or sectors that we are confronted with. So first, COVID-19 had asymmetrical impacts across territories, but many policy responses were place-blind and uniform, if you will, highlighting the need for place-based and people-centered approaches. Second, the crisis strikingly exposed inequalities across communities and places, especially in large cities, where vulnerable groups such as migrants, the poor, women, and the elderly were hit hard. Third, the health problem is not related to urban density, but rather to structural inequalities, and the quality of urbanization and the urban premium will likely not turn into an urban penalty, so to say, as agglomeration benefits continue to prevail. Fourth, digitalization, a major game changer during the crisis, will remain a key component of a new normal, although teleworking ability varies both across and within countries. Fifth, trust as a key component of the paradigm that we are looking at. COVID-19 bears implications for governance, with citizens' trust in government increasing in some countries, especially for local politicians, and decreasing in others. Six, COVID-19 shock calls for a stronger focus on resilience. Preparedness to future shocks requires managing what WHO does what at which scale and how for more resilient cities. Seven, global agendas such as the SDGs and the new urban agenda as part and parcel of it are both timely and relevant to reshape planning, policy, strategy, and budget from the ground up. And last but not least, eight, recovery from the crisis should be a shared responsibility across all levels of government, which should leverage financial resources and good governance to deliver opportunities for all. The way in which we designed and build our cities also for the future will be critical and therefore the position and the meaning of events like these and all the involved stakeholders really are crucial. Urbanization has to be managed in an inclusive and resource-efficient way. The pandemic is exposing the quality of governance and scale of inequalities in our cities and beyond. What we need to do at this point is to look what has been working and what is potentially not, and take a lesson from the field, from our experiences, but once again, also looking at the governance perspective of it on various or on multiple levels. And this is what I would like to finish with, emphasizing the governance perspective once again. And of course, when I'm doing that, I do realize or do refer to different levels of government, but that also includes the UN or the UN system, if you will. What we need to do 75 years since the creation of the UN, and in the aftermath of the pandemic, also at the UN, is to revisit how we are taking decisions, how efficient our work is in that particular context, and where we should do better, because often it is proclamations and statements that we are good at, but what we lack or what we fall short of are implementations of those decisions and the way we try to achieve serious and real improvement in the lives of the people that we serve. And as you know, there is no coincidence that the UN Charter starts with the words "we, the peoples." So I would like to leave it at that and encourage you to continue bringing us together for important discussions like today's. And also, let's see how we can try to involve collectively even more actors, including our young people, who are often among the most vulnerable, and yet they are the real drivers of change that is often needed. I thank you. Back to you. Thank you.
Thank you, Mr. Ambassador. We're at time, and I know that Lance has a conclusion that will bring us home and bring it all together. Before that, though, I'd like to acknowledge those who have asked questions in the chat room, and very quickly to try to answer two of them. Susan Chin, who has worked in government and in the NGO sector, asked, how can architects and planners best work with government for the future of building back better? Great question, Susan. I wish we had an hour to address it on all levels. I would just answer on behalf of everyone else, creatively, diligently, and around the clock, as you have done in your career. Thank you. And Frank Harusik asked a excellent question on community, talking about the importance of neighborhoods as the strength of cities, and asking about how can communities, including housing, retail, restaurants, and social services come closer together. And Frank, I would suggest to you and everyone else on the call, listen in on first Thursday Green Cities lecture. The next one on June 3rd, we'll have Marianne Waller, philosopher and urbanist who is senior advisor to the mayor of Paris, talking about the 15-minute city and then some. Not a question, but the very last word in the chat room that resonated with me is someone I don't know, Meg Needle, AIA. She wrote, I think the point is humans don't control the earth or nature. We are just part of the entire ecosystem. If we kill our host, we go down with the ship. My last remarks are not my own, but that those of Tracy K. Smith, poet laureate, appointed in 2017. In her poem, An Old Story, she gets from I think where we started today to where we're ending up, or maybe where we started as a society before the pandemic, and I'd like to think where we're going. She wrote, "We were made to understand it would be terrible. Every small want, every niggling urge, every hate swollen to a kind of epic wind. Livid the land and ravaged like a rageful dream. The worst in us having taken over and broken the rest utterly down. A long ago past, when at last we knew how little would survive us, how little we had mended or built that was not now lost, something large and old awoke, and then our singing, this discussion, perhaps, brought us on to a different manner of weather. Then animals long believed gone crept down from trees. We took new stock of one another. We wept to be reminded of such colic." The real closing remarks are by the CSU president, Lance J. Brown, FAIA, former chair and director at the Spitzer School of Architecture in City University of New York. Lance, bring us home.
Thank you, Rick. I want to start by very sincerely thanking everyone who helped bring this program about. From the CSU, Urs Gershat, James McCullough, and Alia Jelek, and of course our moderator, Rick Bell, and our team, including Tony and Gizem and James and others. And from the AIA New York chapter, Ben Prosky, Suzanne Mex, and James Hansen, of course, Ken Lewis. And from the United Nations Habitat New York office, Christopher Williams and the indomitable Naomi Parek. This could not have happened without you. And given what I believe is the great success of it, we owe you a debt of gratitude. I, of course, want to thank all of those who agreed to present their thoughts and share their experiences with us today. At this point, I'm sorely tempted to be hyperbolic, but instead would like to take a bit of my time, we're over in any case, to underscore some of the messages we heard. I'm going to try not to repeat the last 3 hours, but I think there are certain things that people can take away. I'll try to be succinct in doing this. From Chris Williams, I think the best I can say is his reference to the UN publication, Cities and the Pandemic. Please take a look at it. It speaks to what his concerns were, and it gives a very good roadmap and an assessment of where we are. Mr. Bosker, the president of the General Assembly, I think started with a very, very profound comment on local and regional ecosystems, issues of biodiversity, issues of man and nature and city and environment relationships. Many of the things he introduced were revisited by others in greater detail along the way. But I think that whole idea of biodiversity, food security, health, and the need to intersect that with the new urban agenda's clear blueprint needs to be taken into account. I also think we should look forward to the high-level midterm review that will take place in Nairobi, again, as a scorecard of where we are. Peter Exley and Ken Lewis both helped us understand how the design professions are responding to the existential challenges of our time. I think Peter very nicely complemented the UN Habitat strategy of the moment, which is talk is good, but action is necessary. While Ken offered 5 strategies in his accounting of the just, the cellular, the porous, and the networked city, introduced by the pedestrian city, which I think we've all come to know much better. And I think it was eloquent, his development of that. Alia talked about the growth by 2.5 billion people on this planet over the next 30 years. This is a central core to what the CSU mission is about, and many of our programs are in response exactly to that projection. Dr. Jha's presentation, he started by saying that 90% of the children were out of school during the last year. An extraordinary opening comment, and followed with the idea that cities cities are more enduring, cities are more dominant, and cities are more coherent than their larger or smaller components. I think many of us on the program agree. He went on to give great detail about how the various components of the city are going to need to be responded to. I think he was supportive of the idea that people will not flee the cities, but the cities in response have to be more welcoming when they return in terms of each of the environments that they will engage, interior, exterior, and the social as well. I think Mary Bassett introduced the idea most succinctly of the segregated and inequitable environment we inhabit. This is so much of the news, how much of it relates to health, obligations in transit, structural inequalities, and the devastating effect of these all need to be incorporated. I think, in fact, the closing comment referred to that. Whereas Professor Hamidi talked about the difference between density and crowding. She was the first to do it. She did it beautifully. It's an open area, which many of my colleagues devote all of their time to. So that's just a quick lessons that has to be incorporated, and it has to be used to counter the misinformation that is prevalent. Ed Masria, at this point, is a living legend in his work on trying to bring us successfully into the 21st century. When I first met him, I must say, I thought there was a little bit of pessimism, and I'm very pleased that in his further research and investigation, he's shown us a way that we can actually do in the 20 years we have available what was done in the 27 years of the expansion or explosion, if you like, of the early industrial 20th century response to innovation. I think we need to heed his words and share his words. Science matters. All three, Professor Sokolow, Mr. Malakoff, and Anu Ramaswamy, all gave us very succinct senses of, in scale, industrial ecology, buildings, apartments, individuals, and the way in which we discuss and communicate these things. I was especially moved by David Malakoff's sense of how journalists play a role in this, because in a way, one way or another, we are all journalists. We are all, those involved today are certainly involved with sharing the good and information and knowledge that's necessary to disseminate in order for us to approach a successful urban future. Thanks to Rick, we had a little nice summary of that panel. And finally, in government matters, we're very, very pleased to welcome back Mayor Vrabanovich. He's visited with us before. He always shares good information on how to progress into the future. But I think his comments on interconnectedness in government, somewhat reiterated by his panel colleagues, his comments on readjustments, moving from big to mid-sized cities, dealing with the vacancies in downtowns. But I think mostly two things: the role of digital technology in going into the future, and the very serious and great need to attend to the arts and cultural, the face-to-face components of our urban environment. Mrs. Oxman-Cabrera is always elucidating. She gave a good 10-point program, including that we have to now build resilience, increase public engagement, increase transparency, encourage community participation, again, exploit digital technologies and make sure that they are exploited with universal access, do more with crisis management, something that the AA New York chapter has been a leader in, and certainly develop strategies to leave no one behind, very much in keeping with the new urban agenda and the sustainable development goals. I want to thank Representative Mlinar for his closing points on COVID, the asymmetrical response, the inequalities, the health and density issue, again, repeating some of the good information of the predecessors. I think the notion of trust that he added to the conversation is critical. We're certainly having that as an issue through our recent election and moving into the future in terms of working together as community. Risk management again, and the new urban agenda and the sustainable development goals. I want to invite everyone on the program and all of our guests to visit the CSU website. You will find this program reiterated. You will find other programs of ours available for your perusal. We encourage you to share your email, review our publications and videos, and register, as Rick has said, for our 4th session of this year's Green Cities program, when Marianne Waller will talk about Paris's Green Cities initiatives. With all of that, and understanding that everyone has a second show today, I want to thank you all for joining us. I want to thank our panelists again, and I wish you well. Thank you very much.